Hello, everyone. Thank you for joining our webinar today. We're expecting a lot of people, and initially we had, I believe, something along the lines of an expectation of about 100 people. Well, like I said in a couple of posts a little while ago, we blew way far ahead of that, and I believe we, at least the last time I checked, which was about 10 minutes ago, we had about 545 people registered. So that's amazing.
Wow.
We had to put a cap on this for 500 people. And so at the moment right now, that's who we expect. And so if you're out there, that's fantastic. And we're really glad that you made it in. So obviously where we are is an unprecedented moment in time. And we really want to answer the big question that's probably on most of your mind, which is how your cataract and refractive surgery practice can survive the coronavirus chaos. And so what we're going to do is, first of all, I'm going to introduce some of the people who are involved in this. We're going to begin with myself, Rod Solar. I've been, many of you probably know me already. I've been presenting at ESCRS for the last 10 years. I've been working with many of you over the last 20 years. Myself and my partner, Laura Livesey, started Livesey Solar back in, early 2000. And we've been working with lots of folks based in London, also in the UK, and beyond into Europe, most recently in loads of different places too. Laura, she's on with me. Would you please introduce yourself?
Hi, everybody. I'm Laura Livesey. I'm the Managing Director at Livesey Solar, and we're really looking forward to sharing with you, I hope, some anxiety-reducing approaches and a bit of a framework today to give you an overview of what is possible, as opposed to what we know is potentially very negative future that we're hearing about in the news. We've been working with refractive and cataract practices for the last 20 years, and together with Mike King, who we're really pleased to be working with, we wanted to combine our global expertise together to produce something for you at this critical time that would be a real help and would be able to help practices that have some foresight to see what's coming, the ability to really leverage what you can do. So we're really going to be focused, and I'm particularly very passionate about helping you focus on things you can control. So we're going to be talking a lot about that today.
And I'll turn it over to Mike King, who is one of our panelists today. Mike, if you could introduce yourself, please.
I'd be more than happy to. Hi, everybody. My name is Michael King, and I'm the founder of the LASIK Marketing Agency. My background is I have worked for 12 years, actually, inside a clinic. I was able to work alongside of my brother, Dr. Joseph King, in Canada and the United States. So you name it, I've done it inside a clinic. I was their VP of marketing. I managed the call center, patient counseled, worked in the OR. So I really get it, not just from an operational standpoint, what's going on inside your clinic, but I've also founded my agency, LASIK Marketing Agency, and we serve clients around the United States, Canada, and I've also have worked in Europe as well. So spoken at ESCRS, ASCRS, AMO University. Despite the fact that I'm wearing glasses because I'm not a candidate, I'm very passionate about helping our surgeon clients to be able to grow their refractive volume. And to Laura and back to what Laura and Rod said, yes, this is very unprecedented times. I'll be able to speak a little bit more about what's going on in the United States, but I'm just beyond thrilled at the content that we're going to be able to share with you today. I think it's going to help a lot of you put your minds, where at all possible, a little bit at ease. And so with no further ado, Rod, I'll pass it back to you, my friend.
Thanks very much. So we also have Georgie. Georgina is helping guide our little background technical support here as well, and providing you with all the back end that is necessary. And also, if you need any help with your technical aspects, we also have Katerina in the room as an attendee with you guys, who is able to answer any questions you guys might have over chat. So there's a couple of facilities to do that. In regards to questions, you will see a raise your hand feature. We won't be answering questions verbally, like in terms of like listening to you guys, speak. But what we'd like to do is please use the Q&A feature. You can type in your questions there. We will be seeing them come up over time, and Georgie will be alerting us as to which questions we need to answer while we're here with you. As well, there's going to be several polls, and we'll get into those momentarily. So for now, I'll just get into the content. So we've been working in a lot of places, and of course, we said that before. Some people asked me, you know, whether or not this was a UK-based thing, or I'm sure Mike's got the question, is it only US-based? This is worldwide. You know, as global as this pandemic is, so is this problem, and so is this solution. So everything we're going to be talking about here relates to your practice wherever you are. I know we have people from all over. I had a look briefly at the registrations, and we're going to be asking pretty soon where people are from, so we get a bit of an idea in order to tailor our content if we can. In terms of who we are, we're not going to spend too much time on who we are and what our surgeons say about us, but rest assured, while we've been in this industry for a collective time of now 55 years, we've had a lot of people that we've helped, and a lot of folks just like you who are listening today who've said wonderful things about us. So this is not really to sell us as somebody you should listen to. You should probably know that already. But what this is really about is to solve your problem. So we're going to get, you know, fire into that right now. So the key messages I want to communicate to you guys is this. This too shall pass. This is a big problem. This is an unprecedented problem. We've never seen anything like this before. But I want to assure you that this too shall pass. Whenever we've experienced dramatic shifts, dramatic changes that have been negative, we've always experienced an upturn on the opposite side of that. So we know without a shadow of a doubt that this also will pass. And in every other circumstance, not only has the global economy come back stronger, you know, I can cite many examples from history in which we had the biggest booms after the biggest hardships. The laser eye surgery industry, the refractive surgery industry will also come back. So I think it's absolutely critical to recognize the long view in this and not fall into you know, any kind of freeze or panic state. Fortunately, I'm talking to pros in terms of dealing with things like emergencies. So I have a feeling you guys, you know, are going to have a pretty level head here. So you're not going to make any rash decisions. I also want to make it clear that you can make it. So some of you may be looking at some pretty dire circumstances, and we completely empathize and certainly can appreciate these dire circumstances. But I want you to really, really take away this key message that you can make it. If you play your cards right, yes, there is a very low margin for error here, because many of you have been perhaps at a low margin rate. You've had challenges with marketing in general and getting patients on board. You know, fear is always an issue. Cost is always an objection. And now we have this. So I want to communicate to you, you can get through it. You can make it. And this is your opportunity to shine. I think as well, leading into that, this could be the moment, in fact, that for which you were made. I know that that is certainly the case for us. We've spoken about this together in terms of how we're going to respond to this crisis. And we couldn't feel more invigorated. We believe that it's in the moments of the biggest challenge in which the leaders rise. And I believe that many people on this webinar listening in are in fact leaders. If you weren't, you wouldn't have started your own clinics. You wouldn't have become doctors. You wouldn't have become refractive surgeons. You wouldn't have become super specialists in your field. You are defined as leaders. So this is the opportunity to remember what got you to where you are and to continue pushing that same agenda forward. We have a plan. That's the good thing about this, is that we didn't lie down and go, oh, woe is me, what are we gonna do? We decided, look, we gotta sit down, we gotta spend hours, we gotta put extra time, and we gotta formulate a plan that's gonna work for you guys. Because look, we owe our existence. The people on this panel owe our existence to you guys. And we've been owing that existence for the last 15 to 20 years. So now it's time for us to give back to you and make it really, really easy for you guys to get on top of this and hit the ground running with a plan. Now is not the time for you guys to figure out what the plan is. Now's the time for us to give you that plan. Now, we're gonna give it to you. And that has to be really, really clear. This 1 hour here follows on a blog post that we wrote that has an extensive set of information that was provided for free. In this hour, we're gonna expand on that. So, while we gave you some little crumbs in the blog post, we have over 60 points that we're gonna cover in this webinar about specific things that you can do with us or without us. You're gonna be able to take these things and move them forward so that you can act right now and plan for the future over the next 3 to 4 months, so that you have the #1 opportunity in order to survive in your space, which is what you need to do right now. Now, the rest is gonna be up to you. It's always been up to you. You know this, and really, it's for those who take this information that you have been provided, who take it to the next level and then take it to action. Now, some of you may be thinking, wow, I got so much to do already. How am I going to, how am I going to benefit solely from one blog post, maybe some social media posts, and one, nice hour of content? Well, look, we're going to make it super clear that you're not going to be alone here. Okay. I want to be very, very clear about what to expect at the end of this webinar. We have a plan that we're going to be able to share with you over this hour that you're going to be able to take away and immediately act upon. It's going to be phased out, step-by-step roadmap. That's great. And you'll be able to really take that and act. Some of you, however, may feel like, wow, there's just a lot of stuff that I don't know how to do. This is a lot of stuff that I used to have staff to help me do, and now I don't have that staff. Or this is a lot of stuff that I'm so busy basically trying to do what I can to get by that I need someone else to help me with. We will not leave you without an opportunity to get assistance. And we're going to introduce that opportunity at the end of this webinar. So we're going to give you that opportunity in order to take a facilitated group approach to address this challenge and get through to the other side and really potentially succeed, and if not, at the very minimum, survive through this crisis. That is our commitment to you, and we were going to make that available to you at the end of this webinar. So please stay till the end, because that opportunity will be presented, and we really want you to take action on that. In the future, if you need our further assistance, we're always going to be here. Look, Mike, Laura, and I, we've been in this business for 55 years combined. We plan to be in this business for the next 55 years combined. And we hope that you're with us. So look, if you don't take action today, that's okay. Obviously, the first movers are going to have the advantage. We all know this. That's the case in life, no matter what. And if you've got to be a second mover or a third mover, look, that's okay. We're not going anywhere. This isn't going to be like, do this thing with us now or never do it. But we know that it's the first movers that are going to really have the very best chance to make it through this crisis and get to the other side. So we're going to be presenting that option to you at the end, okay? Now, let's get into the problem really specifically. So the old life is gone, the new life is here, and I think that it's, with no exaggeration, that you guys are at a turning point in history, not just for refractive surgery, not just for cataract surgery, but for the world as a whole. And when that happens, we've got to change everything. We've got to relook at everything. And one of the key things to consider here about change is that it's those who respond to change best are the ones who really manage into those new situations and get through it. That is, Darwinian theory at its purest. And here we are. We are in the moment where the fit will survive. And we want to make you as fit as possible through this process. In order to make that work, though, your mindset here is going to be absolutely everything. Because you might be, I have a feeling that none of you are in the denial phase anymore. This thing is hit. It's here. No one can be in that denial phase. No one can be understating it. Everybody knows the severity of this issue. Some of you, however, I can completely appreciate, could be in the panic stage. The key thing is to be okay to be in that stage for a moment. Look, we're human beings, right? We all have pressures, we all have concerns, and we all have lapses in our ability to keep it together. But you can't dwell there. You absolutely cannot dwell there. We have got to get together. We have got to move. We have got to take this thing to the next level. And for that to make it, to make that work, our mindset has to be 100% on point. And really what that means is we can't panic. We can't freeze. We can't take knee-jerk responses. I mean, I have already heard of clinics in various locations around the world doing things that I'm thinking, no, don't do that. Don't do that. You don't have to do that. There is a way out. So look, I don't want you to be in that category. I don't want you to make those decisions that are irrevocable. I want you to be in a position where you can make those decisions that are smart, that are deliberative, and that really make a difference and contribute to your future. So look, you didn't spend 5, 10, 20 years building a clinic just to see it vaporize away, okay? What you did is you built a foundation on which many people are served, and you can continue to serve those people to the fullest of your ability into the future. And we're going to help you make that happen. But you got to be there. You got to respond appropriately. So that brings us to the 5 phases of the COVID-19 crisis. And I've just recently shared this on social just to give you guys a little preview in terms of what we're looking at. And if you take nothing else away from this, take this, because this is the big perspective. This is the big roadmap. All right. You know, like when explorers land on new territory, they don't have a roadmap, right? What they're doing is they go onto the beach and they see what's above. And then they go up a mountain and they see the view from there. And then they got to go down and go to the next mountain and see the view from here. So the thing there is that that's exceedingly a dangerous way to travel. If you don't have a map, you have no idea what valleys, what rivers, what pitfalls you're gonna drop into. So having a map is absolutely essential. But here's what this is. This is a roadmap in terms of how this thing's gonna play out. Now, who can tell the future? Do we have a crystal ball? No. Do we have, a prognostication? Are we using Nostradamus? No. But what we do have is experience from previous situations that have been similar to this. We can extrapolate as well from the near-term situation that we've seen in Italy. We can see what's going on in China. We can get a good sense in terms of how people tend to respond, because we're all about understanding our patients and our patient avatars. When we understand that so deeply that it's right here in our core, we can make educated guesses that will allow us to essentially predict the future. And I believe that from all the people that I've shared this with, and I went to my clients first, and Laura and Mike have been sharing this information with our collective clients, and they respond with, yeah, you know what, that's true. I see that. That makes sense. So we're feeling really good about how we're looking at the future, and we think that this is in reality what's going to happen. So let me get into this.
Hey, Rod, just before you jump into the phases, which I know that we're getting questions already. So I've started to see a couple hands raised, and I know that you guys are going to have a lot of questions. So maybe instead of raising your hand, if you can, there's a little Q&A area on your webinar at the bottom. If you just want to click as we go, add any question that comes up and just put as many as you like in, that will really help us, because we're going to use these at the end for Q&A. So start the questioning now when Rod mentions things in certain phases. If you have a question about the panic phase, if you have a question about the boredom phase, just pop it in the Q&A and then we'll get to that. So we make sure we want to answer as many of your questions as we can. Yeah, great. That's excellent. Yeah, because that's the benefit of having this thing, live and interactive, right? Because we could just put this on video and then, you have to wait to get your questions answered some other way. This is the moment. But yeah, absolutely. Use that Q&A. That's what you use in order to get those questions asked. And we'll answer them either live or potentially in text. All right, so really, really quickly, because we're going to go into each one of these phases, and I'm going to need you to be very, very clear about the distinctions in these phases, because they're going to matter in every single way over the next 3 to 6 months, okay? Now, what we've done here in terms of the timescales, look, we don't know specifically what these timescales are going to look like. We're not epidemiologists. We're not, infectious disease modelers, but what we can do is we can look at what's happened elsewhere, and we can get a good sense in terms of what those experts are telling us, and get a good sense in terms of how this is going to play out. The denial phase, that extended for quite some time, and for different countries, it was different amount of time, 2 weeks, 3 weeks, that type of thing. And basically what characterized that is that people were like, no, this is okay. It's not a big deal. We're going to get through this. It's, and look, maybe you guys as medical professionals were a little bit more savvy about this, but your patients, many of your patients were absolutely unaware of what was going on. I mean, I saw people booking eye surgery appointments right to the last day, okay, before clinics were shut down. And you probably as well have seen people in the restaurants, see people in the bars, you see people out for dinner, old folks too, doing everything that they normally do. We're in the denial phase. And that's one of the big reasons why we're playing catch up a little bit here with our measures in order to address this issue. Then of course, then we got into the panic phase. And when did that start happening? Well, then we got to, the government started taking this a bit more seriously. We started seeing reports come out to the hardest hit areas like China and Italy. When it got to Italy, the West woke up and started going, wow, this is actually could happen here. And then we went into the full panic phase. And you saw the toilet roll hoarding. You saw the runs on stores. You saw, I was in a queue to order food. I was 5,000th person in the queue. I mean, I've never seen anything like this, and I'm sure you're in the same boat.
And that obviously creates some panic. So among your patients, some of them just froze out and they just said, look, I'm not doing anything, I'm going to cancel. And others, you know, probably just stopped looking entirely because all of the news was all about COVID-19. That's it. And you've seen that everywhere on social media, every single post, COVID-19, coronavirus, right? On the news, nonstop, 24/7 cycle, coronavirus, COVID-19, everything's about that. But eventually that's going to pass. While the face-to-face opportunities have now pretty much eroded to almost nothing, I know that in various places around Europe and certainly America, you know, and in some places in well, you know, South America, but not so much Australia, certainly, but not so much Asia because they're in a different phase. Their face-to-face activity has basically gone to zero, okay, mandated or voluntarily. And now they're moving into the boredom phase. And the boredom phase is basically when people go into isolation, go into quarantine, and this is a phenomenon that we'd never experienced. But there are massive opportunities within this scope. Then after all that, and I'm thinking, you know, okay, you know, my best guess, right, is maybe like 12 weeks, 16 weeks, something like that. Then we're going to go into the hope phase. And then the hope phase is basically when we start to see the light at the end of the tunnel and we start thinking, okay, this isn't going to last forever. There is a way out of this. Things are getting better. The infection rates are going down. Life is going to start to return to normal. But is it? No, it's going to return to a new normal. And that new normal is going to be completely different from what we've seen today. Now, in terms of our procedures coming out, you know, our bread and butter things that we work on, LASIK and SMILE, PRK, that's not going to do so well. And I have lots of reasons that I can share in terms of why I think that. I went into in the post a little bit, but I have a feeling that's going to be a really difficult area to focus on in the future. But, you know, for those of you who are invested in that, there is still gains to be made. Presbyopia correction is, I've been saying it for years and years and years, that's going to start to, you know, improve. This is the time, really. Now, the way I see this is like, it's not like all of a sudden there's a whole new cataclysm of change. Yeah, it's a huge change, but this is like a little fire that's been building and building and building. And basically this virus just poured gasoline on this fire. So this trend of these boomers having income and wealth in order to proceed with presbyopia correction, that's going to only continue. Millennials, on the other hand, oh my goodness, they're going to be in a really rough spot. Like they will never see wealth. This is it. It's you know, this is it for them, unfortunately. Cataract surgery, on the other hand, wow, that's going to explode. There's going to, you know, a lot of cataract surgery is done in the public domain. There's always a wait list. And listen, that is going to have an incredible pent-up demand in which people are really going to be able to take advantage of that amazing opportunity that will arise when millions of people for 3 to 4 months will have not had the opportunity to deal with something that continuously gets worse as time goes on. And we're going to get into summer now, and it's going to get worse, and people are expected to be at home using their eyes. It's going to feel like, oh my goodness, all I got are these 4 walls and my eyes aren't working. So yeah, it's going to be big, and you have an amazing opportunity to capitalize on that. Look, I'll get into the specifics now. But before we do, let's have a poll. I want to understand, what phase is your market in? So now that I've explained these phases, we're going to pop up a poll up here. Georgina's going to help us with that. And we're going to ask the question, where do you think your market is? Okay. So there's the poll. We want you to vote. Where is your market? So those of you who are, you know, in the early stages of this are going to be like, yep, denial for sure. And those of you who are like, oh my goodness, you know, this is like the first couple of weeks of this thing, you're going to be in the panic phase for sure. Not you guys maybe, but certainly your prospective patients. Boredom, yeah, some of you are going to be in that boredom phase in terms of like, you know, we've been shut down, we've moved into this phase now, and people have nothing to do. Hope, you know, I know for sure that some of you folks in Asia are most likely to be in the hope phase. What's amazing too is that some people in China and South Korea and Hong Kong and Singapore are already in the new normal. From what I understand from connections in that I have, and if any of you guys are in those countries, you guys didn't even shut down. That's what's amazing. And from what I heard, like, you know, during this whole crisis, there was a 20% dip in your volume. If we could all be so lucky, you know, so here, there we are. So look, looks like we've got the poll, and we're sharing those poll results. So look at that. So by far, there's a ton of panic, right? Okay, so we're right at the beginning. But you know what? Guess what? That's good news for you, because the earlier you are in this, the more you can do, really. And you know, like that's how you have to look at this. The earlier you are, the more you can do. So, you know, I'm
cool. And before you jump into the next slide, Rod, just a note, because I know that we have, I'd say 90% of you are refractive and cataract practices, but we also have some cardiologists, some podiatrists, some dermatologists on as well. So this can apply equally as well to you. Obviously, the things on the right-hand side are very much geared to the majority of you on here, but this is going to impact you all very differently, but the process, the phases that your market is going through will happen. And so you just need to adapt your messaging appropriately to the phase. So we'll get into that, and that will apply to you as well.
Yeah.
Go ahead, Rod.
The rule of thumb is this: if you have a predominantly, or if you're predominantly selling things to millennials, you're going to have a tough time. Okay. If you're mainly selling things to baby boomers and Generation Xers, you're going to be a bit better off. Okay. So that's the kind of rule of thumb that you can take away from whatever it is that you do. You know, obviously there's specifics, and maybe we can get into that more specifically at another time. Okay, let's move on now. Denial. So look, for those of you who are denial, we're not going to spend a lot of time here because there's only a very small percentage of you in this phase. But here's where you are. Now, what I'd like to do is I'll turn it over to either Mike or Laura, whichever of you want to get into this. In a moment, you guys can discuss tactics in terms of the kinds of things that could have been done in the denial phase. And for those of you who are in the denial phase, still could be done. Importantly, because we're in direct contact with our clients on a weekly basis, we told them to do many of these things because we were seeing this happening. And so they jumped the gun and they were on top of these things. The reason I show you this is because basically where we are here is everywhere to the left of the UK is most likely in the US is most likely in to a degree denial and panic. Okay. And then everything right here in China, right here, that's looking a little bit more hopeful, right? Because look, that curve is looking a lot better. And these folks, South Korea, Japan, Singapore, Hong Kong, they're doing a lot better relatively. Okay. So phase one denial tactics, who'd like to take care of that?
Yeah, I'll jump on this one, Mike, and then if you want to take
Sure.
the next couple. So I think in terms of denial, because many of you aren't in this phase, I'll just mention what we've done. So our clients, obviously, we a few weeks ago, a couple of days after who announced it was a pandemic, we literally locked ourselves away for a couple of days and came up with a program, and we've been implementing on that specifically and through the denial and panic phases with our clients. So I'd say the most obvious thing to change is to remember that people that you're messaging to will be annoyed that things are changing. They really want to sort of maintain the status quo. They're not really wanting to shift their life and accept the new reality. So you want to have messaging surrounding last chance. So you want to have messaging on your website that this is your opportunity. You've got an opportunity. There's a short window that you need to take action on right now. So you want to change your calls to actions on your website mostly. You want to get people in immediately, not for online consults, which we're going to talk about in the boredom phase, but for in-person still. So they're still not really that bothered that there is a virus going on. And so you don't have to do too much messaging around that because you haven't really gotten into the lockdown phase yet. So it's less of an issue. But you are basically allowing people that want the opportunity and don't want to go into lockdown with visual issues to have that last chance appointment. I'd say that's the main thing that you want to do. So you want to get things on your website in terms of calls to actions, pop-ups, things that basically will make them realize they have an opportunity, but it's a very short window. And we're talking, a 1 to 2 week window. And it's very much about those people that you can just book in for the short term before you close down. So if anybody is there, I would get those up on your website tomorrow and book those people. And we were seeing people book until the very last day before shutdown, as Rod was saying. I think the other thing to note is just to maintain your paid traffic instead of that knee-jerk reaction of cutting it. Keep it going if you plan to capitalize on that phase. And when I say capitalize, I mean offer the opportunity for those that will be inconvenienced, because obviously for some people, if they were planning it, and they were really excited about losing their glasses and not having to have contacts during a pandemic, which of course is a great opportunity. It's a valuable service for you to offer them. So I would do that, and I would do it soon. I think that's all we need to say about denial for now. Can't hear you, Rod.
Yeah, so yeah, I mean, you're right. We don't have to spend too much time on denial. I think a few key points to leave you off with that. Brief your phone team to prepare for a proactive response. They're going to need to know what to say. So if you don't have that verbiage prepared, you're going to be kind of on the hook. I hope that many of you done that by now. Initiate an immediate hiring freeze. That's not the same as fire all your staff. Okay, that's really, really different. But you know, I know somebody who was like, you know, well, look, we have somebody coming on board next month, so I think we're going to bring them on board. I'm like, no, don't do that. Just immediately initiate a hiring freeze. Put out your fires. Identify your key staff that you're going to keep through the crisis. So who's going to help you? Well, you know, maybe you're going to need at least one person to answer a phone call. We'll explain why in a few moments. Maybe we need to basically keep in touch with some people who are going to be able to help us remotely. Okay. So because there's going to be opportunities there. Message your creditors, let them know specifically what's coming, you know, let them know what you're going to do, you know, be really clear about your situation. Immediately collect all your receivables. If you have anything owing to you, I know a lot of LASIK practices are like, you know, pay me now, I'll treat you. But then there's a lot of practices not in America who actually invoice. My goodness, get on those invoices right this minute. If you're in the denial phase, get on those invoices and collect immediately. Do not wait, because pretty soon people are going to have to make choices. And continuously watch your mindset, right? Like this in the denial phase, you know, like just I mean, you've seen the world, you've seen what's going on, but you're going to start really potentially slowly slipping into panic here. And you know, just watch that. Don't let that happen. You know, try to avoid too much news. This is not the time to inundate on that. Okay, let's go into the panic phase. A lot of you are in the panic phase, and I'm sure a lot of you want to know what to do in that situation. The panic phase is right here. We're in the second phase. Face-to-face consultations have dropped down to almost nothing. I wanted to highlight this area, this chart here too, because now that we're getting a lot more data in terms of countries, it's not about countries anymore, it's about cities. And cities are starting to wake up to the fact it's like, yeah, there's some really big differences. So if your clinic is in one of these cities, this is what you're looking at. You know, London, that's where we are. We're not looking so good there, but my goodness, I wouldn't want to be in New York right now. Washington, DC, sorry, that's Washington State. That's another big hotspot. Yeah. California is a big hotspot. Actually, Mike is actually in Washington.
Yeah. Yeah, it's amazing. I'll touch on that when I talk about the next slide there.
Yeah. So look, I mean, there are some very specific things that are happening in each city that you know, and I know most laser eye surgery and refractive surgery providers are based in these big urban centers, so you're going to be hardest hit. That's where the density is. This is an overall view in terms of where things are. I mean, yeah, I know you guys see the news. You probably don't need a lot of you know, updates from us about this, but yeah, these charts are from basically yesterday. Okay, so listen, somebody asked earlier, can you guys do a poll to understand where everybody is? So we're going to do that. So Georgina, if you could initiate that poll and asking people, where are you guys in the world, so that we can get an idea in terms of where our audience is coming from. Wow, okay, so I'm seeing these numbers come in, and looks like we got a lot of people, yeah, from North America and Europe. Yeah. Okay. And I have a feeling that some of you folks from, you know, if you are in Australia and Oceania, well, you're probably asleep right now, so you're not on this webinar. And what's also amazing is that Africa seems to be remarkably untouched for now. Right, so I think we're still voting, are we? By now you've probably voted. This was a really easy question. Georgie, if you can end that poll and share that out, that'd be great. So that's what we're looking at. We've got 46% of the people in North America. Go NA. We've got Europe following the in second place in South America. It's nice to see a lot of folks from South America. That's really good. You guys are really ahead of the curve. I have a feeling that many of you in South America are probably you know, seeing your patients in the denial phase right now, because I mean, I've been following the geography a little bit, you know, quite closely in terms of where people are at. I have relatives in South America. Yeah, absolutely. I can see that things are starting to heat up, but nowhere near as bad as everywhere else. Okay, so that's great. So we're going to stop sharing that now, and we'll move on to the next phase. So Anybody want to take this phase 2 panic tactics?
Yep, I can go for it. At this stage, and I say this is where a lot of us in North America specifically are going to be at. And this is the moment where it's wise for you to just pause your paid traffic. Not necessarily that means that you're going to stop doing it altogether for the duration of the crisis, but that let's just, kind of just collect ourselves and then just pause what you're doing on the paid traffic side so you can be able to retool and come back in with the virtual consultation, which we'll talk about a little bit later, that messaging, and just kind of make sure that a lot of practices that I work with have various specials or things that they have going on. For example, one client had a St. Patrick's Day promotion that they were running. We stopped stuff like that just because you want to make sure that you're relevant to the situation that's going on right now. And then number two is you still have that opportunity for being able to get patients in to have surgery. So you want to look to some of the call to actions that are directly on your website and be able to adjust them to reflect that. What we've also had some of our clients to do is to add a pop-up that goes directly when somebody comes to your website. There's a little pop-up there that talks about that they're now able to do virtual appointments, or we have it as a little bar just right underneath just right at the top of the homepage of the website. And the main thing that people, your patients are looking for is a little bit of empathy and just being authentic and adopting that human-to-human approach. I think now is the time when patients are really going to be wanting to have some connection with you and your brand, and making sure that you're letting them know what's going on at your clinic. Rod, do you want to add any points to that?
No. That's absolutely right. No, sorry, I touched the screen and moved forward. So please go ahead. And unless you want me to move on to the next one?
Next screen is fine. Yeah.
Fantastic. Great.
So I think that, depending whether or not you're a LASIK or cataract or you're a combination of both, people are going to be having questions about, the urgent eye issues. And, it's a great time for you to be educating your prospective patients on how to avoid infection with your contact lens wear. So with one of my clients, we're going to be doing today we're going to do a video similar to this on Zoom. We're going to have a slide or two up, and one of the things we're going to talk about is contact lens wear and hygiene during this crisis. And I think just doing a simple Zoom video like this and then being able to upload it directly to social media, those are the things that patients are looking for. So being present and trying to think ahead as to how can we be serving the patients that we have. And if you have laid off your staff, I would strongly advise that you still want to enable yourself to have a remote contact center to be able to handle your calls. In North America, I recommend all of our clients on using optical. I know Rod and Laura, you've got some options as well for that. But if you are laying off your call staff, you still want to have somebody who's able to answer the telephone for patients that are giving a phone call to your clinic. And I think that you don't want to lose sight of certain things, again, that you can control. Specifically, if you're looking at your website and you may be having an increased amount of traffic to it. So you want to just talk to if you still have your team that's handling your website, making sure that your web speed is up to snuff, and making sure that if there's, to deal with increased traffic of patients coming there, you want to make sure that everything on their experience is up to par. And so the big thing, to point number 4, that I would highly encourage all of you just, again, on a daily basis, to watch your mindset. For me, what works for me is I'm on my Peloton every single day. It's actually, I was talking to my brother, Dr. King, yesterday, and he got a Peloton, and that bike is great for getting yourself and working through that frustration, whatever it might be for you, because a lot of us can't go to gyms right now and exercise. Think about things that can help you just to release the stress and anxiety that you're facing, because your team and the market and all your patients need you to be on point mentally. And I think that's the most important thing, is get your mindset right, especially in this phase. Calm down what's going on and to be able to prepare you for the work that's ahead. Next slide, Rod. I'll turn this one to you.
Sure. Yeah. So I think that what's really important to note here is that your market right now is, if you're in the panic stage, is all think of physiological needs, right? And like, how am I going to eat? How am I going to stay? How am I going to stay healthy? How am I going to stay safe? Safety is going to be, the paramount concern. And when people are in those need stages, they're not going to be thinking about anything else. So self-actualization, which is typically one of the main reasons why people have eye surgery, especially elective eye surgery like vision correction, that's, or because of self-esteem or esteem, or in order to attract mates, like, for vanity purposes, for love and belonging, those are going to be put aside, and they're going to be put aside for these 2 weeks. So that's one of the main reasons why we're suggesting do not bother at this stage trying to get anything in place when it comes to awareness. What you need to do here is start preparing for the next phase. Okay, so we're going to get into the next phase now, which is the phase that a lot of you guys are in now. Especially certainly we here now, we've been on enforced lockdown, I'd say, for about 2 days, 3 days now. The days are starting to blend. Boredom, here we go. So boredom phase is right here, and this is the time of most activity. So listen, I'm going to turn it over to Mike and Laura to both kind of jump in on these things and just basically riff off, whatever's in front of them, anything they want to share, because there's loads and loads of tactics here in the phase 3 phase. So I really want you folks to pay attention, because this is exactly what you need to be either looking forward to doing or starting right now, depending on where you are in this phased approach. Okay, so feel free, jump in. Laura, you're on mute right now if you want to jump on.
I can start out with Laura, and then I'll pass it to you. And so
Great.
one of the questions that I get a lot from a lot of our clients is, what do you do with respect to paid traffic? And there's two sides to this coin. Side number one is, well, hey, let's just stop it completely because we're not able to monetize that traffic, get patients in, et cetera. I would urge you to think the other way, in the sense that a lot of practices, and we've been seeing this around, especially around the United States right now, is that a lot of your competitors are stopping to advertise. However, there are certain clinics that are continuing to advertise. And, I'm seeing in major metropolitan markets where you typically will see 3 people advertising on Google, I'm only seeing 2. And to me, I'm like, that is a phenomenal opportunity to build your list right now at fractions or pennies on the dollar, if you will. Once you retool your offer and really you're able to start offering virtual consultations, that is right now is the best time to still be present in your market. Because what you don't want to find yourself in is, yes, the situation that we're going through right now is dire, and it's a very challenging time. But what you want to think about is on the back end. What we want, and I can speak for all of us that are on the panel here, we want to help you to have a full surgery schedule when things kind of come back in. And if you are not present in your market right now, what's going to happen is that you're going to be releasing all of those other leads to somebody else. And so I think that's a big one that I would recommend, is to retool your offer and then be able to go back into advertising. And I'd also like to advocate specifically on Facebook, because Google is more search-based intent and Facebook is a little bit more interruption style advertising. I believe that offering virtual consultations, and we're going to be launching this as well with our clients, is going to go really well on Facebook, because as people are in that boredom phase, people are craving connection. They're craving the opportunity to, they really want to have that sense of normalcy in their life. And so, you also want to consider, and Laura, I know you're going to love to talk about number 3, about the avatars. Just before I bounce it to you, I'll say one thing, is that the mindset of patients is shifting, and it's shifting for the foreseeable future. And we need to be in tune with that and recognize that the way that we marketed to our patients in the past is no longer going to be the exact same way we need to market to them now and into the future. So Laura, I'd love to hear your thoughts on the avatar side, because I know that's something you're quite passionate about as well.
Yeah, no, that's so important what Mike just said there. The shift that we're seeing from the panic phase to the boredom phase is quite dramatic for a couple of reasons. The panic phase is really, I think a lot of people have only seen the panic phase. And I think that is the competitive mindset difference that Mike was talking about as well, that if you go into fight or flight and you see panic and basically you think this is it, it's going to be like this, people have gone, they're not interested in LASIK anymore, that's it, it's over. You completely missed what's happening here. It's a temporary situation, the panic phase, and then we shift into the boredom phase, which means that your customers have not lost interest really. They haven't lost their desire, I should say. They temporarily lost their ability to take action on their desire. So in the boredom phase, they have that ability back. And this is a crucial, when we, it sounds very simple, but when we realized this was a big epiphany for us, because the boredom phase for you represents an opportunity to plan. If I could, I should have written across this slide 4 letters, PLAN. This is the planning phase. And so the reason we have to plan is because, as Mike said, the psychology is changing. The reason we need to advertise is the psychology is changing in your avatar. And what I mean by that is, if you're messaging right now, you know, all the typical messages for laser, you've got your freedom, you know, freedom from contacts and lenses, you've got your safety angle, you've got your dating angle, you've got all of these different wonderful benefits that people can get from laser and cataract surgery. And cataracts on the other side is people's world is shrinking, and you're allowing them to restore their youthfulness, get their life back, do the things that they enjoy, all of those things that they get back. Well, those desires are still there, but now in the boredom phase, they obviously have to be tempered with their ability to get them in a different way. And so now we need to engage with them while they're sitting at home, or, you know, possibly maybe working a little bit at home, but having a lot more free time, and engage with their need to be stimulated, to be entertained, to be educated. So this is an opportunity for you to provide them with content. And so we need to update our patient avatars to describe that, to say, who are they now? What do they want now? What are they looking at? And so as we go through these phases, we're going to say the same thing in every phase. It has quite a dramatic difference, though, is that you need to update your avatars because you need to message to them differently. So that's what we need to do, is identify, how are they feeling now? How are they feeling before the surgery? It's slightly different now during COVID. How are they going to feel after? Well, that's also slightly different. So we need to understand what it is that they want after surgery now. It's quite different. So there's more of a safety element. There's a safety element in acquiring the consultation from the safety of your home, that kind of thing. So we'll talk a little bit about that. And then you need to, besides the avatars, you want to then take that messaging and put it on your website and change the imagery around. So I think some of the traditional LASIK imagery might be a bit glib right now. It's a little bit too unbelievable. I mean, you don't really want images of people running around outside with 5 other people, because they can't do that right now. So we want to address the imagery and make it for right now. And so that people see that actually I can access, this is for me now during COVID. This product that I'm looking at, actually, I can start planning and getting my life back now. So that's the general messaging. We're going to get more into that in the hope phase, but we need to update our website so that our avatars, our prospects, can see themselves right now. And then we need to make a decision about the positioning. So this is a bigger discussion, and we don't have enough time to go into this. We could spend a whole day on this, but really, if you look at the market and where it's going, and Rod alluded to this, the difference in income for millennials, I think they're going to be hit very hard in different countries differently. Obviously, I think we're going to see a big impact in the US in terms of the millennial side. So we need to look at where the chips will lay after the end of this, and what typically happens in a recession. So we've gone through and outlined that there's sort of 13 pivotal trends that come out of recessions that you need to sort of look at in a business. So you need to apply these trends and look at the fact that the luxury market doesn't really ever go away. And so there always is a market for the more upmarket side of things. And typically we don't see enough practices pivoting that direction. A lot of people play it safe, and they try to have offers on the one side and go a little bit down market. They try to sort of have maybe a little bit of a luxury feel, but for a value price. That's kind of the middle of the market. That's going to go away. So you need to make a decision. And if you have the chance, if you have the facilities to pivot towards more of a luxury, a higher end, now is the time to make that call and start moving towards it, because we're going to share this with you. That's where the opportunity is going to lie. A lot more. There will be some in the lower end, but it's a lot less, and there's going to be a lot more competition there. So you want to get to work on your communications, your facilities, and your prices to be more in alignment with where the trend is going. We can see that now. We know this is going to happen now. We don't know exactly when, but this is what's going to happen. So you may as well, if you have that opportunity, position yourself within that, move towards that. So we can go to the next slide, Ron.
Yeah, and one quick thing I wanted to add on to that, Laura, is, and I know we've talked about
Rod,
this.
you're mute. I think you're both.
Okay, sorry,
yeah.
Mike. If I can just,
Yeah,
I want to answer a question that that someone posed. What kind of images would you suggest for the website? What kind of examples? You know, instead of the images we might have right now, which are like, you know, people like doing all the things that we normally do. What would you suggest?
Yeah, sure. So what we're looking at right now and what we're doing right now with our clients is we're looking for real, like this is what I mean by updating your avatar. What is your avatar doing right now? Well, before they probably, if they're working from home, and chances are you want to go for the ones that are employed and working from home, they're gonna, you know, be sitting in front of a screen before, they're gonna be wearing their glasses, they're gonna be rubbing their eyes, but more by themselves. So I wouldn't show big group get-togethers with people wearing glasses. I would show one person, you know, rubbing their eyes, that sort of thing, in front of a computer. That's very real, that's very believable. And then afterwards, they could be doing things, you know, with their family at home. So you can have them enjoying their life as it is now. You can show them outdoors running on their own because they can do that. Most of us can get outside for a little exercise every day. It's just the reality that we have now. So you want to make sure that it fits the stage we're in. So if your country right now is in a full lockdown, the after should reflect what's happening right now, but the good points of it, you know, in terms of sitting around having a family meal, playing a board game, doing things that you can do in your home now, and enjoying that freedom from glasses in context.
Yeah, I think also a really important point here is that, you know, I just see somebody, it's like, after a lockdown, you deserve freedom. That's the message. You're right. But with that said, I want to be really, really clear. You guys have to know this. This social distancing thing that you've all, like, this is a phrase we hadn't heard a month ago.
Yeah.
But this social distancing thing, it's not going to go away as quickly as it came. Okay. It came fast. And so some people think, okay, well, this is like something that was like turned on with a button, and all of a sudden now we're social distancing. And then we can just click that button again, and all of a sudden we're not social distancing. No, that's not going to happen. We are going to come out of this really slowly. And the reason I think that is because we're already seeing fears of reinfection. Now, this is a virus, and you don't usually get it again, but we're already seeing 14% of people tested in certain areas in Wuhan showing signs of having yet something else. And maybe it was a testing error, we don't know, but, you know, eventually we'll know. But it's not about what we know, it's about what we perceive. The other thing too is, it's not like we're going to all have immunity after, you know, after a period of 3 months of social distancing. What's going to happen is there's going to be a lot of people who are social distancing will avoid this bug, and then will go out and catch it. Okay. So this is going to be a second wave thing, a third wave thing. And the countries that want to avoid being completely overrun with their public health services or their private health services, in the case of the Americas, they're going to have to keep flattening this curve, And what that means is, you know, releasing in order, it's almost like a, you know, you're releasing a dam. You open up a vent just to kind of release some pressure, and then, okay, back we go. And then releasing, okay, back we go. So we're not going to be away from social distancing, I think, for potentially 12 months. Okay. Now that's going to be that's going to have a massive impact. I'm going to talk about that a little later when it comes to positioning. But one of the main reasons we're talking about move to the luxury is because we're not really going to have the opposite luxury of having cheap laser eye surgery in the future. Okay. Why? Because we just can't do high volume in an environment of social distance.
Well said. Yeah. I was going to make that point that, you know, one of the common things that I hear from a lot of clients in North America is, well, how do we compete with the 220, 250, 495 an eye tactics? And, you know, what I would say to you is that patients, even if they respond to that and they go into that practice, nobody is going to want to be in a high volume clinic with a lot of people sitting in the waiting room and a lot of people waiting in to get their eyes taken care of. So it's just a simple matter of us now being forced into this social distancing. I really think, and I would echo what Rod and Laura are saying, that moving up market is the best thing that you should be doing, and positioning in your own mind that you're not going to, I think the days of having super high volume days are over for the foreseeable future.
Yeah. Okay. So let's get into the, you know, depending on positioning, rework your messages. This is a great opportunity for cataract surgery. We've already talked about this a little bit already. Somebody in the chat said, you know, how can we like not make the same mistakes of 2008, where we got all scared of laser eye surgery and then reverted to kind of like a cataract surgery focus, and we started relying on that. Guys, it's not about changing the market, all right? Like the best way to succeed is to go with the market. You cannot change the market, okay? You go with it. And what's going to happen is that cataracts are going to see a boom. So I'm not saying, like, you know, all of a sudden you got to throw out laser eye surgery. I'll never say that. But cataract surgery is a massive, massive pent up demand. These folks are going to be sitting around 3 to 4 months. And listen, they're the ones who are going to experience the most severe social isolating situations. Here in the UK, we're days away from enforcing a full lockdown on 70-year-old pluses. Okay, what that means is they cannot leave the house, not once. Okay, so that is absolutely dramatic, and we got to be very, very clear that this is going to be a massive issue for those folks. And look, they're not going to be able to have people visit them. They're not going to be able to go out. They're going to be lonely, right? And you know, at the best of times, these folks really, really want to talk to people. And this is an opportunity for you guys to engage with that market. Leave them alone over these next 3 months, and somebody else is going to swoop in and be their best buddy online. And that's who they're going to actually end up going with. Okay. So this is your opportunity to attract that focus. You got to look at your website on your, you know, and make sure that you start thinking about cataract surgery. Right. Listen, guys, we, you know, I can see, let's see the numbers here. Yeah, we still got 390 people in here. I don't think we ever had, you know, everybody show up, but that's great to see 390 people still in this webinar after 50 minutes. So this is obviously going quick for people, and we can keep it going. All right.
And just to manage everybody's expectations, I expect we'll spend a little bit longer, because I know we're getting a lot of questions, and I think we have a lot to cover, and we're happy to give it to you freely. So we may go a little longer. I hope you appreciate it. I do apologize if you were trying to sort of have most of the content in 1 hour, but as you can see, there's a lot that we need to cover here. And I'm hoping that we can all make use of the extra time that we have at the moment to make sure that we get our plan right for our practices. This slide is really critical. So shall I jump in, and then you guys can add to this? So BOREDOM is really, for me, we've talked a lot about the planning side and getting your avatars right and the strategy right. And now I think a lot of you are, and rightly so, interested in, okay, great, what do I do? So once you have that, and again, I cannot stress enough that tactics are meaningless without the strategy behind them, without the knowledge of how to apply them. And in every single phase we're going to go over right now, the tactics may be the same, but the application is completely different. So in this stage, what we need to do is create stuff that entertains people. So we talked about that. They're bored, right? They're bored, they're anxious. There's a whole bunch of other feelings. It's not just boredom, and we recognize that, depending on how your country is progressing too. This is a very serious issue, and obviously we have older people that are in serious risk. But I do think that there is a great vast swath of people that are at home not knowing what to do, needing to kind of figure out how they're going to spend their time. And so we have the opportunity to help them with that. And so what we can do is, one of the big opportunities that you have, and I'm sure Mike is going to speak to this, and he does a lot of work with this, is getting people to create, doesn't have to be studio quality video, getting people to create engaging video. So making video that is topical, that addresses the needs that people have now, and that is educational. There's a lot of interesting eye needs. I was just talking to one of my staff members today, and this isn't eye related, but it's a similar idea, where all of a sudden during the lockdown, they're getting a toothache. So what do? You know, like, you can't really go anywhere, you're stuck, right? So the same thing, if you get eye issues during this time, you have an opportunity to provide some information. You have an opportunity to talk about the future. You have an opportunity to talk about what you could do, and how this experience at home and how this lockdown is really impacting your life, obviously specifically relating to your eyes. So you have a lot of opportunity to make video. You want to add content to your site, because Google's not shutting down, and a lot of your competitors are, maybe not permanently. Some of them are also shutting down permanently. We've just received notice that some have actually sacked all of their staff and are actually shutting down permanently in some markets, which is very sad. But at the same time, it obviously creates a vacuum in the market, and there will be a need to serve customers in your market. So there is more opportunity for you to keep going with Google, produce more content, and allow yourself to rise up in the ranks in the meantime, while we have this time, before we can actually have in-person consults, to create content so that we can then book online consults. So this is all what this is about, is engaging with people. And as Mike said, building your list, so that we may not be selling right now. This is really not the time for selling per se. It's a little early, especially in early BOREDOM, but we have the ability to create content and plan and get ready, because the time that's coming next, the hope phase, it's all guns blazing to get people into online consults and help them to take their life back, because they're itching to get back to their regular life. So this content area, please, Mike, jump in on the content side of it.
Yeah, I'm going to talk about two of them there, B and E, because those are the ones that we've done a lot with our clients. So I'll give you a very specific tactic on the video on the homemade side. So right now, everybody's at home. And so what I have done with clients of ours, and I would advocate for you guys to do this as well, is we do videos like the top 10 questions about LASIK, or the top 10 questions about premium lenses, or about cataracts. And what we do is you put them into 10 different slides. And then what I do with our clients is I interview the surgeon, similar to what you're seeing right here, except we're both on a Zoom meeting. So the prospective patient gets to see the surgeon as well. That helps to accelerate trust, if you will. And so we create that, let's call it like a 10 or 12 minute video. So we take 60 seconds to 120 seconds on each question. Then what we do is we take that video and we splice them into individual videos, put a little bit of graphics on it, and then we can use those on our website, use them in emails, use them for retargeting. So really from a 12-minute, 15-minute video, we can have 10 or 12 videos that we have created, put up on YouTube and whatnot. That's an extremely cost-effective way. And I moderate them with our clients because I sort of serve as the moderator and ask the surgeon the questions. That is something everyone that is on this webinar right now, if you are in a clinic, can do. On the webinar side, I've been doing webinars for years and they've been extremely successful and with all of our clients. And the webinar I call it, it's like the best way to convert those leads that you spent your hard-earned marketing dollars on, doing a webinar. And I would typically have done them pre-COVID once every 4 to 6 weeks. And it's a great chance during lunchtime for somebody to have the opportunity to, we go through some slides, 30 to 45 minutes. The patients get to ask any and all questions that they want. That's the we've done before. What I would say is now, that even if it's just doing a weekly FAQ or like coffee with the doctor or something like that, being present for your prospective patients and doing it via a webinar format is a great way for you to remain engaged with your clients. And so I very much advocate doing webinars and the videos that we have there, homemade videos. Laura, any other comments you want to add?
Nice. And yeah, I think we talked a little bit already about updating your patient-facing materials. I'll just give an example because I know we're talking sort of a lot about things you should do, but generally what we're talking about here is practical things like, you probably have some email follow-up sequences so that when people inquire, they get a few emails. Yeah. So you just want to check those and make sure they don't say, come on in, make sure that they say, book an online consult, update all your links, make it context sensitive, have a little discussion about what you're doing for COVID so that they don't feel like they're just getting a robot sending them things. It needs to feel fresh and current. Okay, these guys are really active and this clinic is happening now. This clinic is here to serve me now. So just make sure you go through and look at it with a COVID eye. Look at everything that you're doing and say, does this make sense? Would somebody be able to use my service now in this way? So do that. I think the other thing is, in terms of the key messages and the calls to action, is you want to be saying things like, in your ads and anything that you're running at this stage, you're going to lead in with, are you tired? Are you tired of being at home and blah, 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 whatever they're doing, well, here, I've got something for you. You're going to go in with that lead in. You're addressing how they're feeling right now. And let me help you start planning, the next step once we're all free of this. So take this quiz, find out if you're suitable for laser eye surgery and be one of the first to get on our wait list. We're going to talk about wait lists in a moment. But that's the kind of message. It's are you tired of this? Well, then do this, so you get them thinking like, oh yeah, there's something I can do now.
Okay, good.
Yeah, so I think I'm just in the interest of time, I think we can move forward after. What I will say about this is the lead magnets that you want to create right now. And a lead magnet is just something of value. So a quiz or a guide or something that is easy to consume, really quick, kind of fun, like I was talking about, something that you can do right now while you're surfing the net that will give you a valuable piece of information in exchange for your contact details. That's all that is. So you can make quizzes and guides and blog posts if they're a bit of a longer read. But you can make content that allows you to build your list. And really, BOREDOM is, as I mentioned, not so much about monetization quite yet, maybe at the end of it, but it's more about getting people on your list because you are getting ahead of your competition if you're building your list during this time. Again, think of this as the long game. We have a plan. You're looking at the entire period. You're planning on surviving. So this is how you do it. So you're building your list so that when the time comes to move, you're shooting ahead. So you're building your list. And then we've got some cataract specific ones here as well. So I gave a LASIK example earlier in terms of getting a quiz, finding out if you're suitable. This one for cataracts is, well, how are you dealing with your eyes right now? You know, we understand you have cataracts. It's, you know, you felt like your life was shrinking already. Here's some guides, here's some ideas for how you can cope. It could be to the family members as well. You could pitch it at family members. You know, are your family members suffering from cataracts? Well, here's a way that they can cope during the COVID crisis. So again, you build the list so that when you come out of this, you know, it's very frustrating. It's going to be really frustrating. This is a great opportunity for cataract practices. It's going to be so frustrating that you can't treat your cataract. We've heard in the last week, so many of our clients have said, yes, I just had somebody call me and say, you know, I couldn't get it done in the NHS. Can you do it right now? But of course, all elective facilities have been shut down in the UK, so they haven't been able to do it. But they could have got that person on their list. They didn't at the time, but now they're ready to do that. So you want to be ready to offer people information so that you can get their information. You can give them useful information for the whole of the period, so that when they come out of the other side, they're going to call you and make sure that they book in as soon as they can.
So this is just the information regarding the online appointments, and I'm not going to spend a lot of time on this. This is the whole workflow here in terms of how it works. Listen, the key point here with online appointments that I want to make is you got to be having these online appointments in such a way that obviously you can't be doing clinical things, right? There's a few things actually that I've spoken to a lot of surgeons that they could do with, like, you know, with charts and things like that. And there's lots of, like, you know, phones that take, you know, you can take pictures of your eyes and things like that. So there's a lot of things around that. But look, you can't obviously make somebody, you know, qualify them for eye surgery and then avoid all the necessary steps in order to actually treat them. But the key thing here is to have that emotional conversation with somebody. Initiate the online booking, connect to the diary, make sure that that's all kind of working for you. Set up a Zoom conference just like this one. That's how you can have these appointments. Connect it to a payment gateway. Many of our, you know, I know that the norm is just to offer free appointments. That's fine. But I've spoken to lots of folks who actually are thinking, maybe I should be offering some of these appointments for, you know, for some money, because it's the doctors and the optometrists who actually might be doing these appointments, not just patient liaisons. And so that's an idea, because if in exchange for that appointment booking, what we could do is we could reserve that person's place in the queue for when all of this comes back to normal. Because over 3 to 4 months down the road, then, you know, everybody's going to have to start at the beginning of the queue. So what we're doing here is we're getting people in the queue early. It's also given us potentially an opportunity to get some cash, which will help us put into marketing, especially when we're starting to get out of this phase. The nice thing about this too is if we're doing Google ads for this or Facebook ads for this, the prices are going to be like rock bottom cheap.
Yeah.
So now the whole issue becomes just get the awareness, just get the appointment, book the appointment, get the wait list going. And then by the time you're actually out of this, you got a whole bunch of patients that you've already engaged. You've taken them off the market, right? And now you can treat them, okay? Others won't be doing this because they'll be thinking, I'm a doctor. All I do is do doctoring things. I can't do that over Zoom. No. This is about getting them emotionally committed. Okay, we're gonna have another poll. Georgie, if you can throw this poll up there, please. It's, are you currently offering virtual appointments for cataract or refractive surgery? So we wanna know if you're doing this already, okay? So please pop that in there. I suspect, you know, we have a sense of what's gonna happen here. We got 344 people in the event, so it's going to take a while for everybody to get their numbers in here. But yeah, we got a few raised hands. Just so you guys, in case you joined late, if you're raising your hands, we're not going to actually address raised hands. What we want you to do is put your questions into the Q&A. Had a question around this. I think it looks like we got. Hold on. Most of you filled it in. Listen, you're going to give you like 5 more seconds to fill this in because we got to move here. Okay. All right, we can share those. Yeah. Cool. So what are we looking at here? We are 21% of you are already doing virtual appointments. Well done. Well done. Good for you. Those of you who are not doing it, it's time. Let's get moving. Okay. It doesn't really matter what phase you're in. The sooner the better. Get those things set up, and then you can start offering them when the time is right. And the time is right at the inception of the boredom phase. Okay. Cool. So we can stop sharing that and move on. All right. Now we're into the hope phase. We're almost there, guys. Isn't that
Yay.
wonderful? I mean, that'd be really nice to be there now, wouldn't it? Wouldn't we all like to have a little hope in our lives at this moment? Well,
Some
there
of you
is.
are, which is
Yeah.
impressive.
Now, the key thing here is to consider, okay, where is the hope right now? Okay, the hope right now in the world is in China. We're starting to look hopeful there. We're looking at South Korea. We're looking at Japan. We're looking at, you know, those places. Okay, so that's where we're seeing the hope right now. We won't. The key thing is, where is the inflection point? Where does this curve start to move in the other direction? Because that's when the news is going to start saying, oh, you know, we had less infections than we did yesterday. We had less deaths than we had yesterday. It looks like we might be starting to look at the end of the tunnel here. And that's when the news starts talking that way, then we are going to start to see a little bit more hope. And so, you know, be prepared for that hope phase. Here we go. This is where we are. Okay, hope phase tactics. Who wants to take care of this?
I could jump in on this one. So at this point is when you want to be thinking about amplifying your paid traffic. And this is where, especially because we're now in that phase where patients are hopeful, they're looking at that they want to have that opportunity to be able to have the surgery. If you can, I think we just go back to that last slide.
Oh, I'm terribly sorry. Oh, let me just
fix that. It's totally fine.
And
it's really just, at this point, you've been able to offer, you know, virtual consultations, and you know, patients, you're able to see the light at the end of the tunnel. You're able to see that this is the point where we're able to start doing surgeries. For example, in Washington State, we have a date of May 18th is when we're actually be able to go back and do surgery. And so I can speak to this slide until you're able to go back to the next one.
Yeah, sorry, Mike. Let me just stop the share.
Yeah.
And because I think I can only go back to it if I do that. So I do apologize.
No, you're fine.
No worries.
There we go. And back to this. Now you get to see Mike front and center. Say hi, Mike.
Perfect. Oh, you're front and center for me. That's awesome.
Okay, yeah, all right. And then back to share screen. 1 second. I'm quite amazed that has been the only technical glitch we've had so far. So thank you for that. And let's proceed.
Got it. Yeah, the other thing is, you know, back to what Laura had mentioned about the avatar, just really keeping in mind that the mindset of people is different. The way that you've marketed to them, you know, up until a month ago is that has to change completely. And so we talked about that earlier, but you really want to make sure that that's reflected in the advertising that you're doing. And the call to actions that are on your website, I really do believe that virtual consults are here to stay long-term. And so if you haven't got that, as soon as you're able to offer them, you're going to want to have that long-term sitting on your site, because there's two sides of deciding whether or not somebody wants to have elective surgery. And side number one is, am I physically able medically to have this procedure done? And the other side is, do I have answers to all the questions that I have? If I'm, you know, what is the procedure like? How much does it cost? Financing options. And I think being able to parse out those two different parts of the decision-making process and enabling people to learn about, you know, all the questions we have about financing and what the procedure's like in a virtual consult, that's where your minds need to be going, because that's the new normal that's coming to us. And so, you know, some other things, again, keeping in mind that the content that you're able to create, homemade video is okay, because everybody understands that everyone's going to be used to seeing, you know, Zoom calls with their friends and all that stuff. That's again, very much, you know, 6 months ago, doctors were like, I need it to be a professionally done video and having it in the studio. Now that, you know, just anything having that up there that's reflecting the times that we're in is good for you to do. Adding on webinars, as I mentioned earlier, is a great thing here. And then also just keeping in mind that the content that's on your site really needs to go through search engine optimization and making sure that, again, it's reflecting the current environment that we're in. Laura, did you want to add any points?
Yeah, no, that's great. And I think just from a broader context, so we're going from phase 3, which is boredom, where you're focusing more on list building and lead magnets. So I think a lot of your calls to action should be more geared towards get the lead magnet. So you're going to be pushing people towards your content so you can acquire their information. Now you can go full steam ahead on hope phase. Is all about the online consult, as Mike said. So you change again your calls to action on your website. You change your photos to talk about, you know, the next step. And now we can start to message again about being outdoors with our, you know, with our friends and doing things. That's hope, right?
Yeah.
Hope is we are getting our life back. And we can start to message around this concept of let's move. I'm tired of not living the life I want to live. You can move your life forward. So just take the first step to move your life forwards. You can do that now. So that's the kind of messaging you can start to make now. And you can take the first step by having an online consultation. And you can actually start the process now to get that freedom that you want once, and that's going to come in a month. So if you have the online consult now, as Mike was saying, you parsed out the medical from the emotional. You can do all the emotional stuff on the online consultation. And also some of the medical, I think too, all the factual information you can gather as much as you can, but you can have a good chunk of that consultation. And some practices, I don't know if this is you, but some practices are even able to sort of pre-green light people pending a successful result on all of their tests. So you can sort of say, yep, you're on our wait list. We've booked you in for surgery, and of course it's subject to change, and this has to be suitable for regulations in your area, of course. But if at all possible, they can get a surgery date. You know, you have all the red tape sorted out, but basically they can get a surgery date. They obviously have to come in, have the consent, have all their tests done, and have all of that. But yeah, assuming that you tell them that, yes, as long as that's tick, 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 you can have your surgery on this date. So you're future pacing them, and you're getting them to think about, oh yeah, I can have this in a month's time. Get them really excited about the thing that they want. So we can start to sell that early in the hope phase, which is really exciting.
Danny Barrett. Hi, Danny. How are you? I remember you from London Vision Clinic in the early days. She asks, who or what do you recommend to have in a virtual online cataract appointment? And I think you've answered it, Laura. Keep it emotional. You know, those 10 questions, Danny, that I shared with your team, and also your team up at Custom Vision Clinic, was all about, you know, how do you have a phone call, you know, and like, you know, when most of the phone call has to be about the emotions, you know, why do you want to have this done? What's bringing you to the clinic? You know, when are you thinking about doing this? What do you want to do once we sorted out your eyes? All of those questions, just do them online. That's exactly the answer. So yeah, the other question is, you know, how do I offer online appointments if we do not know how long the lockdown will last? Mm-hmm. Do these platforms allow for constant shifting of the bookings? Yes, they do. And I think you got to tell people, yeah, like we're going to give you the date as much as we can give you. But if we can't possibly give you that date because of regulations, then we just can't do it. They're not going to blame you. They know everybody's in the same boat. But what you're exchanging here is not so much the date. You're exchanging the spot in the queue. So think about that. Reframe it. I'm giving you
for cataract.
It's like, you know, oh, you want my space right here? Yeah, that's going to cost a little bit right now, but that's nice because then you don't have to get in the back of the line 3 months later. So that's what you're selling here, not the date. Okay. Okay. Let's move forward. Yeah. Mm-hmm. More tactics. My God, it's an avalanche of tactics. Let's carry on, guys.
Yeah, I think on number one, you know, we talked about this earlier, and this is, it's one of the concepts I think a lot of us need to wrap our minds around, is that the office experience needs to reflect that new normal of us now needing to maintain social distancing. And so I think that also needs to be reflected in what patients are hearing when they book an appointment, to whether it's on your website or it's in the emails, like, and that's coming back to like all the things you need to be doing right now to retool the way that you're communicating to reflect that social distancing is going to be here to stay for quite a bit of time. And people, even when we're able to be closer in contact, there's going to be that little bit of that hangover, if you will, of people just wanting to be a little bit cautious in case there's a second cycle of this virus and all that stuff. People are going to want to have an experience in your practice that enables you to maintain that distancing, that human-to-human, one-on-one approach. And so I think on question number two, this really comes down to, because I don't believe you're going to be able to do massive high volume, to maintain that social distancing, you're raising your fees and reflecting that, and at sort of that white glove premium service is where you want to be shifting to. And you know, looking at, and I know Rod, you're exceptional at you know, the patient counselor training side of it. You really want to make sure that if you're going to, when the new normal comes in and you're spending, you're investing your money in your marketing, you're getting people in for consults, you got to make sure that the people that are doing those consultations are, you know, sales professionals, that they've had the proper training, that they really know how to empathetically and elegantly move that person to surgery and help them feel comfortable in your practice. You know, because frankly, you know, they should be investing more for the experience that you're going to get at your practice and not going to a place based solely on price alone. And so training for your team is paramount here, making sure that you're not just throwing somebody in off the street that can handle the patient counseling side, but to reflect where the mindset is and the avatar of your patients and how that shifted during this crisis. Having somebody that is able to do that is key. Rod, you want to add anything to that?
Actually, Mike, that's really good. Actually, you've just answered Nick's question. He was asking exactly that. How do we sort of reopen our doors, considering that the cataract population is older, so they're actually most susceptible. Do you have any words for Nick about, he's also concerned that the cataract patients' kids will be a significant influencer. And so he's wondering if you would adapt any messaging for the children of the people that may be sort of influencing them, any messaging he was saying, anything about logistics that might be interesting for the kids to know beyond what you've said?
You know, that's a great point. And that one of the things that, and especially now when, you know, some of the older folks may not be as internet savvy. And so I think if you're thinking from a marketing perspective, you've got the sons, and many of them are in the 40s to 60-year-old, and that are doing the research for their loved one. And so, you know, reflecting that, you know, speaking to that person in your marketing and saying, if you're looking at a cataract procedure for your mother, your father, or whatever, here's everything you need to know right here to be able to convey that back to them. Because it might be that some of the older population just don't have that time. They're not hearing the advertisements on the radio. So being able to kind of tap into the decision-making process and recognizing that there's people that love them that are influencing that decision about where to go for cataract surgery. I think that that's another thing to open your mind to, is that you don't necessarily have to be marketing on, you know, the premium lens side directly to that patient, but also the people that are helping them to influence and make that decision.
Yeah.
Okay, let's go to the new normal, guys. This is the phase we've all been hoping for. So lots is gonna change, but some things will stay the same. So here's where we are. You know, our view really is that LASIK and SMILE is not going to recover as quickly. Presbyopia is going to be a little bit better, more of a winner, and cataract surgery will, you know, win the day, if you like. I think the key point here really is, look, you've utilized a lot of materials that you built during the clinic's downtime, and this is where you really need to now hit the ground running. In the new normal phase, in the hope phase, you know, you've definitely ideally ramped up some of your paid search, right? But now I want you to think about like driving through a curve, okay? Like the people who survive recessions, and we are going to be in one, okay, are the folks who are going to be driving out of the curve in a very accelerated way before the rest of the market catches up. Now, we can't tell you when exactly that's going to be, but there are signs that you'll be able to look for. And as well, it's going to really depend on the social safety net in your particular environment, because if that environment's really, really hard done by, it's going to be much harder. You want to update your patient avatars again. They've transformed during the lockdown time. What are they looking for? I think somebody mentioned earlier, you know, what we have to offer is freedom now. And yeah, freedom is critical, right? But let's not forget, self-actualization is key. That's what freedom's all about, right? But, you know, freedom to be who you want to be, freedom to do what you want to do. But let's not forget safety. Safety and security are going to be all of a sudden super uber important. Update your website to position patients as the hero of a long journey. You've gotten through this now. Now is the time to actually take advantage of your life. Look, one thing that we're going to know for sure is that life is short. At the end of this, there's nobody who's going to come out of this without having somebody who they know personally being affected by this in a very, very serious illness or by death. So look, we're going to have this life is short approach, and that's, you know, it's definitely going to work. Update your key patient-facing materials, right? So now it's time to look at your website, look at your brochure, look at your email sequences, look at your ad portfolio. We're in a new world now, right? But so remember, I mean, we talked about it earlier. Social distancing is going to be here to stay for a while. It's unrealistic to imagine with life is just going to flip back to normal as soon as, like, you know, flipping a switch. I think here is when you have to spend as much as you can afford on paid traffic. You know, if you guys have managed through this phase, here's the deal. We know right now that some folks are already closing their doors permanently. So that means that there's more market to go around. And what that means as well is if you can have some conservation of cash along the way, in other words, you know, it'd be nice to have a good balance sheet. It'll be worse later. But if you manage to pull in some cash from appointments and you've been really, really smart about preserving what you have, then you might be able to use some of that to move forward and accelerate out of the curve with paid traffic, because now's the time when really you're going to need that. Assess the market, look at opportunities. Clinics have closed their doors, right? So now there's new markets able to be served. There's distressed assets on the market. You might be able to, you know, pick up cheap lasers, pick up, you know, look at different premises. You know, it's going to be a different world. There's going to be a lot of staff who are going to have been out of work for potentially 3 to 4 months minimum that you'll be able to recruit now into your clinics. Get in contact with them in the boredom phase, right? You know, start to talk to them, start to engage them. You know, see perhaps if you can, like, you know, work them into your clinic in the future if they're really, really good. And roll out your social distancing protocols in your clinics. I mean, start planning that now, because look, the income and expense sheet is going to change because you're going to be in a low volume environment. There's no way around it, right? So some people are saying, like, are people going to, like, cut their prices, you know, to get patients at the other end of this? Well, maybe, but will they be able to afford it? So that's always the question. Where are the margins, right? Where are the margins? And not only that, but it's coming off 3 to 4 months of, for many, no income, right? So yeah, consider that. Right. So look, at the end of the day here, we have some hope. The Chinese economy is bouncing back. Now, I wouldn't quite call this necessarily a bounce, but perhaps it's just a slow crawl out of the trench. But look, it's only been 2 months. These guys went on lockdown January 23rd. Just a couple of days ago, it was March 23rd. That's 2 months. So look, it's possible, right? Now, we don't for a second expect the West to experience this kind of bounce back. Not at all. I mean, this would be a dream scenario at this stage, but maybe 3 months, maybe 4 months, you know, that's what we're looking at. Now that's the overall, you know, scope of this. And that's what we want to get through, is that this is a phased approach, and there's going to be some time to look at this. And now is really the time to take action. So, you know, wouldn't it be nice, really, wouldn't it be nice if there was an umbrella for you to guide you through the process between this denial and panic phase where you're at now to the new normal? And, you know, if there was an umbrella around your practice in order to, or like a bubble to protect you from what's coming, wouldn't that be great? So that's what we've been working on. And now really is when we're going to talk a little bit about that. So guys, take it away. This is the next step, really.
Yeah, I'm excited in the sense that even just that graphic of that umbrella, it makes complete sense, just given the challenges that everyone's facing. And, you know, I think that a lot of you right now have been able to, you know, hopefully get a lot of tactics and some specific things that you can be able to deploy at your clinic. If you're sitting there and you're thinking to yourself, well, how do I make this happen? And frankly, I need a little bit of help. I need a little bit of guidance, or I just want to be plugged in and working together in a sort of a spirit of harmony and working with other professionals that I know in the industry to be able to make it happen. Well, that's what we'd want to be able to offer here for you here today. And so we really do hope that you've been able to find this as time well spent. But we wanted also now to be able to talk to you about, you know, in this moment, you know, we can provide you with some of the tactics, but really, a lot of you are going to need a little bit of support to be able to make that happen. And so we've tried to cover as much as we could here in the hour, but then we now want to be able to talk to you about an opportunity for us to collaborate and work together. And so what we put together is our CRS sort of COVID action plan. And what we have put together is it's going to be over an 8-week program, and where we'll have that opportunity to be able to meet with you in a group environment where we've got weekly trainings. We're going to be having a weekly Ask Us Anything coaching. We're going to be meeting directly with your practice and kind of having that one-on-one opportunity for us to really find out where your practice is in this moment. Because every one of you are at different stages in the 5 stages we talked about here today. And so what we want to be able to do is to find out where your practice is at, and kind of everybody that is interested and wants to take advantage and be able to work with us over the next 8 weeks, we're going to find out where every one of you are at and be able to tailor make our content for what the group needs. And so the other part of this, which I think is going to be phenomenal, is we're going to have a private Facebook group where you're going to have that chance to connect with other ophthalmologists and other, you know, industries and countries, and just find out what are they doing, and asking those questions and being able to connect with them. And so what we're going to give you is just that guidance on how to be able to execute all of the stuff that we talked about here today, everything that Rod has on the screen of like your pricing and how to help you with positioning and your ads and your copy and traffic generation and things to do on your website, because many of you you understand this conceptually in your mind. You're like, yes, this makes sense. Yes, I want to do this, but how do I make that happen? And I think, you know, for us to be able to go down that journey with you, that's something that we'd be honored and thrilled to be able to do. And what's interesting is that I actually, back in October, intentionally decided to stop taking on agency clients so I could actually spend my time devoted to creating an 8-week program. What's really bizarre is that I just finished filming the first week of it last week. So the timing for me is like, I am absolutely, and I know I speak for Rod and Laura, ready for this moment. And to me, it's so exciting that even though it's a very hard situation for us to all go through right now, I do believe that there's hope and that there's a way for you to be able to navigate this. And that's what we put together here in our plan. Rod or Laura, do you want to add any points?
Yeah, sure. I think what we've got a little bit more detail here on the program, and I think I will say this. I think this program is fantastic, and we're really proud of it. And we have been working nonstop to put it together for you. As soon as we found out that this was happening, I don't think it's for everyone. It requires an acceptance that business as usual is no more, and we will. This is exactly what this is about. We cannot rely on how we've been marketing LASIK for the last 10 years. We've had in the last 10 years unprecedented growth. Since the last recession, we have now had the most wealth creation over the last 10 years than we've ever had in the history of the world. So we're coming out of a boom period. We have now got to shift dramatically and change our approach. So this is very much about shifting our mindset, shifting our marketing, and making sure that we can come out the other side of this hope phase and be able to capitalize on it. So it's really not sort of a couple of tweaks here, a couple of tweaks there. We will be working together in a workshop fashion and really challenging some beliefs, really getting into all the marketing and making sure that you're equipped to come out of the hope curve and be able to book those online consults and convert them. Everything's got to change in your whole sales funnel. So I think before Mike goes over the program here, I think, Georgie, do you have the link? I think if we've got the link, if somebody can pop it in the chat for everybody, we'll send you a link. We've got a program, a page so that you can see more of the details, a bit of an overview, and for you to be able to purchase the program. But Mike, if you want to go over the program and what we're going to do in each week.
Yeah, and to speak first of all about the pricing of the program. So what's interesting is that when I was going to be selling the program, my 8-week program, I was going to price it at $5,800. And what we've put together for you here today is a price of $29.95. And so the $29.95 covers for the 8 weeks of training. You'll get to meet with us every single week, be able to ask any of the questions that you have, and also be able to get all the training that you are looking to get. And week one, really this is where, for those of you that are in the denial and panic phase, is make sure that your messaging is all on point. And so I know that Rod and Laura and our teams, we have a lot of that messaging already created, already done, already in templates we can be able to pass along to you, just to make sure also as well that you've got that side covered. But then really finding out, and this is where we're going to meet with you directly, is find out where your mindset is at and just help you to make sure that you are ready for that journey, because this is a journey that we're all going to be on. To Rod's point, we don't know exactly how long we're going to be, when we're going to be able to go back and do surgery, but we really want to have our mindsets right. So that's the focus of week one. Week two is for us to spend that time in our workshops going through our avatars and understanding our positioning and our targeting and really tweaking our pricing. And just, again, this is a new world that we're living in. So we want to be able to kind of immediately start thinking to ourselves how actually where somebody's mindsets are at, where our patients are at. And week three, this is where we want to be able to, and some of you may want to be, getting online consults right now because you are I'm ready to take them. It's, through the training that we've got, we'd be able to show you, it's actually quite easy to be able to set it up initially, but we want to go through that action plan and, be able to show you the technology of how that works. And so this is really going to enable you to convert patients over the next 6 months. And so week four, this is where we're going to focus on your content plan and being able to make sure that that's reflected on items on your website, looking at different lead magnets that you're able to be able to do as well. One quick thing, Laura, just to mention, I think that some people have mentioned that the link's not quite loading. So if you want to have somebody on your team to take a look at that, be awesome.
Okay, yeah, Georgie and Kate, if you can take a look at that, if you can make sure the link in the chat is correct and that it's loading, that'd be great.
Yeah. You know, another thing is that what I'm really excited about is some of the people that we're going to be bringing in, world-class experts to talk about specific things like SEO and to talk about like Facebook ads. I'm having our good friend Molly Pittman, the CEO of Smart Marketer, one of the most knowledgeable people on Facebook ads, is going to be able to come in and be able to talk about being able to set up a virtual consultation funnel. And so we're bringing in some top-notch people to be able to help us in specific areas to amplify the messaging that we've got for you guys. And week 5, again, this is where you've got to make sure we're retooling your paid traffic plan and just executing that across AdWords and on Facebook. And week 6, we're now getting into the hope phase. And so being able to set up those patient lists and how to be able to do that for your clinic, and just using that online consultation training that we will be providing you. How do you set up that online consult and just enable yourself to convert those patients to actually be on that wait list? And week 7, this is where we're going to be talking about marketing with video. And if you are not currently doing video right now, I highly suggest that you get on it, especially because it's so easy to be able to do it via a Zoom camera. That's a phenomenal way for you to be able to create content. So we'll be able to go through and coach you and provide you with specific, video templates and plans on how to be able to do video in your clinic. Next up, we're talking if in week 8, we're looking into that new normal phase and how to be able to plan what your new in-office patient experience is going to be. It's going to be completely different because we need to reflect where the mindsets are of patients with respect to social distancing. And so, the other side of it is we'll be able to share some best practices to know how are your competitors, what are they doing? Many people may not know that, but within Google, we could be able to see, and I'll be able to show you how you can look at the bidding strategies of your competitors, see what ads they're running, see what type of landing pages that they have, so that you can know what they're currently doing as well. That's some of the things that we'll be able to share you, are just things we do with our agency clients, but I think you'll find really, really useful as well. So the last point I'll mention, and Rod and Laura, I'd love to hear your take, is that this is what we have put together right now. And we also understand that we may need to shape shift and move it around and kind of move one week here and there. And so it's more about how do we serve the group of you that want to come on this journey with us, and we want to come on that journey with you, but we are more than happy to kind of alter this based upon what the needs of the group are. Rod, Laura, do you want to add any points?
Yeah, no, that's a really good point. I think we put this program together in the last 2 weeks, and for the clients that we have that are our custom clients that we work with on a one-to-one basis, we've been adapting really quickly. So you will get the benefit of being able to meet with us every week. We'll be having trainings every week, so you'll get the latest. And so we'll be very clear, like we will adapt. If we see an opportunity, we will adapt the program and make it custom for the moment. And we all expect, I don't think that's a surprise to you, things are going to change. We know that's going to change. But in terms of the trajectory, the trend line, this is the trend line. And you'll notice actually that there's a lot of time in the boredom phase. That's the phase that's just about to come up. After your country's through panic in the next 2 weeks, the boredom phase is that settling down period. That is your opportunity. That's why we spend a lot of time. So we're going to spend 4 weeks on the boredom phase, setting you up for success, so that when hope comes, whenever it comes, and it may be, it may take, 3 months, 2 months, 3 months, 4 months, but you will be ready. So we will be working together to not only give you a plan, but it's called an action plan, because you're getting the information, but information is useless without action. So we will be helping you implement, feeding back to you. And maybe you probably don't need it right now. I think we're all quite motivated, but if you do need it, we can give you a kick in the pants as well. So we can sort of get together and say, okay, this is what you needed to do this week. Let's look at it. Let's feed back to you. Let's adapt it to your market. So it's really a chance to workshop and learn from each other.
And one thing that I saw a question come up is that, well, what if there's somebody on our team, if we decide to come on and be part of this plan, can they join us? I mean, absolutely. If you've got somebody that is able to help implement what you're doing and you want them to be a part of this, 100%, because the idea of this is that, yes, we want you, if you're speaking to the surgeon or the office manager right now, we want you to understand the strategy of it. But then we also recognize that some of you may need some implementation help. And if we discover in our one-on-one calls with you that it's more appropriate to figure out how we can help you implement it, great. But if you have a team, this is the strategy. The strategy needs to be distinguished from the implementation side of it. And so we would encourage you, I would love for you to be able to bring somebody along to also be able to kind of learn some of this content. Because again, we're after helping your practice holistically, not just one singular person.
Yeah.
Somebody asked if we can do this in Spanish. Well, clearly we all speak English here on the panel. However, yeah, I've got quite a bit of facility with Spanish, and I also have contacts in this industry, consultants and coaches who can assist with a little bit of Spanish assistance. We can't convert everything into Spanish, but we can certainly, help you get around this content and get it to the point where you can use it if you're Spanish. So, yeah,
Brad, sorry, go ahead. I was just gonna say, maybe you can throw up the next slide just in case anybody's having. I see a couple of questions about the link.
Yeah, look, we have a link that this is a bit.ly link that goes to the link. So Katarina and Georgie, if this link for whatever reason isn't working, it's worked in testing lots, but go to the link that it goes to and put that link in the chat.
Yeah, the long one.
Yeah.
Just put the long link in the chat, because after all, people just have to click. So so that's fine. So they'll, definitely have a look at that page. That breaks it down. If you have questions, we'll be looking at them in a few seconds here.
Yeah, and Rod, one thing I wanted to I'm sure is the question people will ask is like sort of the first people that are able or want to take advantage of this are going to be the first ones that we're going to have a chance to meet with. Obviously, we can't schedule every single person next week to meet with them one-on-one, but the first people that do are going to have that opportunity to kind of meet with us and really find out where their practice is situated. And as far as like timeline, we recognize as well that this is very much something that we need to be moving on fairly quickly. And so this is not something that if you're sitting there on the fence and you're thinking about it, we're not going to be sitting here for several weeks waiting to get started. We recognize that a lot of you need to get this stuff going right away. And so I think that the launching of this and starting and getting things moving is going to happen fairly quickly.
Yeah. So again, just to reiterate, you get a weekly training, and that's with Mike leading the show there. But we'll be involved in also bringing in other experts. Weekly Q&A, ask us anything. That's a separate setting where Laura and I will definitely be there, and Mike will probably be there quite a bit. And that's I can see loads and loads of questions, and I wish I could have the opportunity to answer them all. But yeah, that's definitely when we're going to be able to address your very specific questions around your specific practice. This is not generic information we're going to be passing out to you. It's specific. It's a private Facebook group, which will also entertain anybody who's involved in the program will have access to us over that private Facebook group, and we'll be able to also learn from each other. That's what I really, really want to come out of this too. This is definitely an opportunity to collaborate. You're going to have guidance on marketing execution. Of course, there's pricing offers, there's positioning, there's ads, there's copy, there's traffic generation, all the stuff that you have to do normally, but in the context of this situation right now. And that's what's the difference between this and anything that anybody else is doing. We're taking our 55 years of combined experience in laser, refractive, and cataract surgery marketing and looking at, okay, now that we've got this new situation, how can we take everything that we know and start to funnel it towards addressing this specific concern? And that's why I think out of the gate, we've got the most definitive view in terms of how to make this work. And we want to get you guys to get involved with us so that we can actually make that happen more specifically to you guys. So yeah, that's what it's about. Now we have a bonus
just
as well.
Before you, yeah, we'll share with
before
you. Sorry. Just before you jump into a bonus.
Tension.
We're happy to, and anybody who's registered already will get this bonus. I just wanted to clarify. A couple of people have asked about registering, and they'd like to register, and they just asked if they can pay with credit card. So on the link, once you follow the link, you just click the link. And you just have to fill in it's a form. So you can just fill in your first name, your last name, your country, and those typical form fields. And then yes, the credit card payment options are there below. So just follow the form fields. If you have any questions, Georgie can help you with that.
Yeah.
Sorry, Rod, go ahead.
No, that's fine. I mean, like, yeah, I mean, many of you guys are on the sales page, you're seeing the price and you're probably quite like, oh, wow, this is pretty good. And the reason we're able to offer such an attractive price on this is because we're able to work with, you know, quite a few of you around the same topic and around the same focus. Now, that doesn't suggest that we're talking about generic information. We're going to definitely be specifying it to each of you, but we're all focused on this right now. So that's the key, is really looking at how we can take what we normally do on a one-to-one agency side basis, which typically we charge, you know, I mean, I have a few clients on this right now. They know how much we charge. We typically charge, you know, 5 figures in order to actually work with them and to get stuff going like this. Now, we're going to be able to focus in on this issue and be able to take what you've already got and really, really convert it into something that's going to work in this moment. And that's why we're able to actually do this in such a way on a group level, and also with segmented groups splintering off of those groups in order to help each other, non-competitive groups. And that's why we're able to do it like that. So in terms of a bonus, the first 20 registrants, and yes, of course, anybody who's already purchased this already will get this. So, you know, time is running out on this one for sure. We'll have 11 digital marketer certification courses. The value of that is alone $5,445. Now, what does this include? Now, this is really especially important if you guys have team members or yourselves. Look, you got time, right? Or if you have team members who want to learn how to market to the most world-class level possible. Each one of us, myself, Michael, Laura, we're all graduates of this program. We all understand this program. And so what we do is we get ourselves to take all these certifications, and we get our teams to take these certifications. So pretty much everybody on our team is in this process. They're doing content marketing mastery courses. They're doing paid traffic mastery courses to understand how to do that, social media mastery courses, a conversional funnel mastery course in order to really understand how the funnels work and how to make sure that you can get people converting down that funnel. Search marketing mastery as well. We also talked about email marketing mastery. All these courses are going to be available on demand. Each one of them is around 7 to 8 hours each. They come with guidebooks. They come with video lessons. Analytics and data mastery, if that's something that you want to know about in terms of
actually, Mike, so we're opening this up for the first 20 registrants, and how long will they have access to do these courses?
It's a great question. I mean, in my mind, I'm all of the opinion of being able to help people as long as possible. Minimum 6 months is what giving them access to all of this. And really, I think for people to kind of wrap their head around that, a lot of you, maybe right now, if you're shutting down, a lot of the expenses that you have, maybe you found yourself like, maybe we right now need to be less reliant on having an outside agency. Maybe we need to kind of be leveling up our team. And so I cannot tell you enough how impactful this content is. And so, on one of them, on the paid traffic mastery, as I mentioned earlier, that's taught by Molly Pittman, close friend of mine, and she's going to come on live on one of our weeks where I'm going to be bringing her in to talk. And so bringing in a lot of the people that are teaching these courses are people that I'm going to want to be able to bring on some of the weekly trainings. But one quick question, actually, somebody did ask: is the fee, the investment, if you will, for the CRS recovery, $29.95? Is that a monthly, or is it that's a singular fee? That's not monthly. That's for all 8 weeks. That includes for the first 20 registrants. It gets you all the certification courses. You'll have access to that for 6 months. This is the stuff that can really be a game changer for your practice. I've taken every single one of these courses, and life-changing, not to oversell it, but really it has been life-changing for me. And knowing exactly what are the things that are working right now in the digital marketing space. And this is a phenomenal opportunity for you to help your team to be able to level up.
I love the question. Is it monthly? Yeah, because I mean, the value of this, it could be priced monthly, but yeah, I mean, price, right? I mean, we could price this monthly for 12 months, and the value would still be there. So yeah, absolutely. This is I mean, look, a big part of this is helping the community, right? Like I said from the very beginning, you guys have supported us for collectively 55 years. it's time for us to give you guys an opportunity really to, get the very best of our knowledge, get the very best of our experience, get hands-on focused attention from each of us, and really, really get the opportunity to get through this crisis, because we're all in this together. Look, if there's no industry after this, then, we all got to find other jobs and got to figure out other things to do. We don't want that to happen. We have a vested interest in this industry. I don't know if there's much else I can do. This is my deal. So I need you guys to succeed, and I will be doing everything in my power to make that happen.
Yeah, I think that's a really good point, Rod. We wanted to price this at a point where you just had to sell one extra patient, two extra patients, depending on what you charge in your practice. So if you think that you can get one or two extra patients out of working together with us on this project over the next 8 weeks, then this is for you. Without sort of before we get into the final Q&A, I think the only other thing that I would say is that the 8 weeks is designed that way because we're hoping for the best. So we're hoping that that we have the China response, and we've got a 2-month window for the BOREDOM phase, which is your opportunity to plan. So we really, as I said, planning is the name of the game here.
Service going and taking that time to actually use that. I don't want to call it sort of downtime, but really it is time that if you're not putting into your practice, you're getting behind, because some practices are doing that. So that's an ideal window in terms of 8 weeks. But if it's longer, even better, in the sense of if you have 2 extra weeks to get your content sorted out, fine. Obviously, we don't want it to go on and on and on. But really, you should be ready, is what I'm saying, from the end of the 8 weeks to start being able to do the online consults and to start getting into the hope phase when you can start getting revenue back. So this is what we want to do, is prepare you for the hope phase, and also give you hope, because we do have hope. We have hope that by following this process and by taking a planned approach to this, that you will be able to survive and come out the other side. So we really hope you join us on the program. And I think, yeah, why don't we jump into any final questions?
Yeah, and before you do that, I got one quick thing. And for those of you that are in North America, if this is your first time, or maybe it's your first time hearing all of us, but I really need to take a moment right now and talk about Rod and Laura and their team. I have been, well, first off, I consider Rod and Laura good friends of mine, but now that I've had the opportunity, especially during this crisis, to be able to be working directly with them, my mind's been blown. Just first of all, guys, hats off, an amazing job to your team on the slides you put together today. I know whether or not somebody actually decides to come forward and be with us in the next stage of the journey, I know that a lot of people have gotten a lot of value out of this. And so to me, I believe that everybody needs to be exposed to the work that you guys are doing, because I've just been so impressed by the approach that you've taken and just the mindset that you have just on how to help our industry get through this. So that's my little, I want to give some love to you guys on job well done, but we can open it to Q&A.
Yeah, thank you, Mike, as well. I want to send out kudos to you as well, because listen, I'll be the very first person to say, this was your idea. This whole thing was your idea. It's like, let's have a webinar, let's get out there and, face the market. Let's do what we need to do. So yeah, sure, Laura and I, we stepped up to the plate. I mean, part of the equation is obviously saying yes, but man, oh man, I'm so happy that you suggested this, because
really grateful. Yeah,
we are going to have this opportunity to help a lot of people as a result. And I've had a wonderful time putting this information together. I see a couple of questions right here. Can I have multiple users on the program? Yes, if they're from your clinic, you can share these resources. Absolutely. We're not trying to this is not a one-person thing. We're not trying to be grabby and things like that. No, you can definitely have multiple users on the program.
The same thing with the digital marketer certification. When you get, use that login for multiple people, that's totally fine. Again, our goal here is to help your clinic holistically. So this is something that you don't need multiple users in the same clinic. Just, have one of you, just one purchase of the program will give you all the bonuses that we had talked about.
If we can put that link back in the chat too. Some people are saying that I can read back, and it says, I'd like to sign up, but it's hard to load the page. Sorry, guys. Yeah, we had a load of people on this webinar. It's an unprecedented number. It's certainly the biggest I've seen for myself. But so absolutely, reload that page and just make sure you give it a few tries. I know that some of the gateways are going to have struggle a little bit with some of the volume here. So you're seeing, yeah. How can I know if I'm one of the 21st how can I know if I'm one of the 21st? They will have that will have a bonus. Yeah. Listen, we'll let you know. You know, we're going to definitely have a back end on this in terms of communicating to you everything that's going on in terms of what you get from this. So yeah, we don't have the numbers in front of us right now. All we know from our team is that things are quite busy and things are, you know, that's great. I'm really glad a lot of you are joining up. So please keep going.
We'll be in
Just
touch, Martine, tomorrow.
Yeah.
So just bear with us, as if it's a little slow today, you will be able to log in, I think, in about half an hour. If it's not loading for you, it will load in about half an hour. And then in terms of the 20 people that got the bonus, we'll be messaging you about that tomorrow. So you will just stay tuned. We'll definitely be messaging everybody about the program and the next steps tomorrow.
So guys, I mean, do you guys want to go back and answer some questions that are still left over?
Yeah, and just for those of you that maybe, you know, have to drop off, please do know that all attendees and people that registered, we're going to send this recording of this to you as well, so that you have an opportunity to, whether it's to show if you're you know, like an office manager or, you know, one of the medical staff, you can bring it to the doctor to watch, or if you have to drop off your for whatever reason, you'll be able to come back and watch the Q&A part. So yeah, let's jump into some questions.
Yeah, so someone who's anonymous says, you know, will the virtual consults that you're discussing, should they be done by the surgeon or should they be done by someone else? You know, can these consults be submitted for reimbursement as telemedicine consult? Okay, in response to the second question, I know that, I mean, look, we're in the middle of a pandemic where everybody's trying to go online. I know that insurers have definitely communicated to our doctors here in the UK that they will be reimbursed for online consultations and telephone consultations. So that's really good news for our UK folks. It all entirely depends on the insurers and in your jurisdictions where you are. You need to check in with them. But look, I suspect that there will likely be a move towards that. I mean, I can't say for sure, of course, but look, everybody's saying, guys, social distance, you know, get these consultations online, go online for everything. So if they don't do that, I'd be very, very surprised. Anyone, I mean, Mike, you might be able to comment further on this. I'm not sure.
Yeah, I was actually just responding to somebody that asked the question. A great question about whether or not, if you're part of the first 20. What I'm going to say is, if you're just outside of it, I mean, listen, I want to make sure that everybody's able to take advantage of this, and whatever extra cost it comes to us to be able to, for those of you that are live on the webinar, I'm just going to do a pivot and say, if you are registering and you register live right now while you're on the webinar, and from the moment between now and it ends, I'll make sure that every one of you gets access to the digital marketer certification. So
that is so cool.
Whatever that is, whatever that cost is, we got you covered on that front.
That is just so cool.
Every one of you, I'll make that happen, and so that way nobody's got to worry about getting the bonuses. Being here on the webinar, everybody's going to get it. That's just a pivot. So I kind of lost track of what you were just talking about because I wanted to answer that, but go ahead.
Don't worry about it. Don't worry about it. Robert,
I don't know if we, actually, it was a really good question. I don't know if we did, sorry, I was just answering a question as well. Did we answer who should do the online consult?
Oh,
Rod,
yeah.
Rod, I think you're the pro at this one. You've done it always, haven't you?
Yeah, look, I mean, this is a great opportunity to get your, if you have patient liaisons that you still have in employment, or if they're working from home, then great, they can do this. This is their bread and butter. But what they might need is some training, right? Yes. So we can definitely give them really, really good advice on that. Laura and I have been focusing quite a bit on doing training and online training for staff. And that's been kind of the main thing that we do, is helping people handle patients on the phone and handle patients on the first appointment. What we don't yet have is an online appointment course, but taking these two courses and blending them in, yeah, look, I mean, that's exactly what you guys need. So,
and what Mike suggested, sorry to cut you off, Mike. I just wanted to toot your horn. What Mike suggested and what we have included in this program is a build it yourself online consult. So Mike's going to be taking us all through that process. So sorry, Mike. Yeah, tell us about that, because I think it's really, really valuable.
Yeah, and you know, this, again, everything is moving at the speed of light right now. And so, you know, I saw 2 weeks ago that it was virtual consultations is the direction that we had to be bringing things. And so, you know, for me, we put together the SOP for like the action plan of how you can be able to set up doing virtual consults. And then the other thing that we're actually creating this week, which we'll have ready for next week, is best practices from the patient counselor side. Like, what are the things that you need to be able to do? Because I'm leaning back on having worked inside a clinic for 12 years. I've done thousands of patient consultations. And so I train our clients as well on how to be able to do them face-to-face. But now there's not a lot of differences when you're doing them virtually, because I think there's definitely some subtleties to that, but there's definitely some mechanics and things on mindset. And there's some technical things you need to have dialed in, but we're going to have that ready as early as next week. And so my gut tells me, Rod, is that we're probably going to want to move to focusing on the virtual consult side, like right away, given that, you know, 70-something% of people haven't actually got virtual consults live. That's probably going to be the first thing that we focus on, is how do we get you to be able to do virtual consultations right away?
Look, in order to help people do virtual consults, we have a section in our training for telephone and first appointments that is all about giving people the access to those 10 questions that we think are magic. I mean, we've been spending 20 years developing these questions. I am more than happy to share those videos out for free in order for you guys to take advantage of that. So if you guys need to understand what questions to ask, how to take those folks through that process, if you sign up, I'm going to throw that in as a bonus. So yeah, absolutely. It's necessary. It's vital. You guys have to know how to do that.
Yeah, this is the time for us to be as generous as humanly possible to help us all out. Love it.
Cool. Let's have a look at any more questions. Sorry, guys, I had to.
Yeah, and I think that, you know, just to respect people's time, we'd be more than happy. I know the three of us to film a supplementary, video or whatnot, going through some common questions people have and be able to kind of post that online as well. Like, so don't feel like if you haven't gotten your questions answered, we're so grateful. We understand that you're all busy in the sense you've got a lot of things to think about. So we can take any of these questions offline and do a supplementary video for everyone too.
Cool. Corinne Patterson asked, what platform or practice is using for online consultations? Look, we're giving people the access, the idea of using Zoom. And one of the main reasons for Zoom is because it doesn't require a download. It's one of the easiest things in the world to actually use. And a lot of people, especially older people, tend to kind of worry about downloading things onto their computers because they're worried about getting viruses. Interesting time for that. So the key thing here is that, Zoom is easy and it works. Look, all of you guys have been on it and had very little issue with it. And yeah,
super easy to use. Yeah.
And I know for sure Zoom is actually booming right now. They're going to be putting lots and lots of money into scaling their servers to manage all this demand. So it is definitely the platform of the future.
Yeah. Yeah, Robert was wondering about the program. Is it a webinar, something that's pre-recorded, or is it one-on-one consultation with a practice? So it's a bit of a hybrid. We will absolutely be giving one-on-one attention to every single practice that is joining us on the program. And then you will have access to us in live training. So it's not pre-recorded. So you will be able to ask questions. But the live training will happen every week. And there's also going to be sort of an office hours where there's a question and answer period every week. So you will get personalized attention. That's how we wanted to set it up, so that you had some access to us personally. Yeah,
definitely that hybrid, because the reality is that a question that somebody asks in one market is going to be relevant to others. And so facilitating it via that group approach allows us all to be able to be working together. And I think that approach of doing it sort of that hybrid of one-on-one, but also when you ask a question, we can be able in the weekly FAQ, you'll be able to be unmuted. If you want to be on camera, great. Well, we can give you that individualized attention in that group format. But I really believe that all of us working together, and frankly, like to Rod's point, we have some things that we can learn from you as well. And so you may be trying something out that can work and help other people that are part of the group that we're working with. So it's a great question.
So I think we've got a couple more questions here, and let's see, Rod, did you want to talk a little bit about the economy and the millennials, and just talk a little bit about, somebody had a query about, you know, why do we have to position more on the high end, and what kind of time frame are we talking about here?
Okay, yeah. So the question about the millennials, right? So already, like I said earlier, this is a fire that's been, you know, going for a while, and what this virus has done is put gasoline on the flame, and basically the trends have been going for quite some time here are only going to get worse. So what's going on? Well, millennials are already in, you know, they already don't have the same wealth as their parents do. They're already considered the first generation in history to be less well off than their parents. They have very low wages. They have, in the US specifically, they have high student loan debt. They also are living in an environment where real estate costs are far, far, far exceeding their ability and their wage increases. And so their ability to catch up to that is almost entirely, you know, out of the question. So let's also consider this. Who are the folks who work in the service industries? Who are the folks who work in restaurants? Who works in hotels? Who works in tourism? Who works in, you know, all these industries that are going to get hardest hit in this pandemic? It's those folks, and those folks are millennials who tend to work in those industries the most. I'm not saying that there are no wealthy millennials. Definitely there are, but it's the minority, and those are definitely going to be, you know, continue to be LASIK patients. But that's why I think there's going to be so few of them, especially then when combined in a social distancing environment. We're going to really have to get away from this high volume thing. So millennials are in a tough spot, and yeah, I think it's going to definitely be something that we need to pivot towards a higher amount of income.
Nice. Thank you, Rod. That's great. And we've got another question about the, so the difference between, this is interesting. This is a bit of a tweak. So it says, how do you foresee converting leads from the boredom stage once they've moved into the hopeful confidence stage? That's actually a really good question. So usually we are kind of, the way we've presented it to you, it is linear. So somebody sort of is in the boredom stage, like say myself, I'm in the boredom stage, I'm at home, and then I kind of shift because the government announces that they're going to be lifting the lockdown maybe in a month. That's kind of the idea. But you're absolutely right that you will have people that make that psychological transition at different time periods. So, you know, maybe Frank down the street is, you know, just doesn't believe it's going to happen. So he's kind of still in the boredom phase. He's like, I'm not going to even look at that. I'm not going to raise my hopes, because maybe Frank is a little bit like that. So we will have people that are different psychologically. But I think what that tells us is, again, that you don't just have one avatar. So this is what we'll be covering in the course, that you really have to go through what we have an avatar worksheet. So we have worksheets for all of this. We're going to be looking at all of your different patient types, because obviously your presbyope is a very different animal from your 25-year-old, you know, straight up LASIK smile patient. So we need to kind of look at your practice and say, as we're moving through this, you will have some people in the boredom stage and the hope stage in the same day of the month, you know, say June 15th, you're going to have people in both stages. So it means we have to diversify your marketing. So we still need to be doing lead generation stuff online and speaking to the boredom people that are still there. And actually forevermore, we need to change up the messaging, but that is an important part of feeding your funnel, by giving people entertaining information and giving them just sort of that first, like dating, that first little interaction with you, that first taste of your clinic, and to be impressed by that. And then when they move into the hope phase, then you can start messaging them slightly differently. So you want to have that going actually at the same time. So that's a really good question. You have to kind of always be addressing different avatars in different ways simultaneously. And that's part of a comprehensive marketing strategy.
I just got an update from Georgie that the link is a lot quicker now.
Oh, great. Okay, fantastic.
So yeah, so somebody worked some magic or something like that. But anyway, yeah, the link's a lot quicker. So yeah, if you've been waiting online in order to go and get that link, the link is in the chat. I think what I might do is actually copy and paste. Actually, Georgie, if you could, please pop it in there.
Yeah, that'd be great. The long link, please. That'd be fantastic.
Yeah, just pop the long link in there. It's there it is. Oh, and there's two short links too. Great. Okay, double your links. There's some questions about EU regulations and compliance, and also data
GDPR.
protection. Yeah.
Yeah.
So look, we've gone to town on GDPR over the last year. I mean, before we had COVID, we had GDPR, right? So yeah, we know that Zoom is GDPR compliant. The key thing here is don't record anything unless you have to. So it's about collecting information and then recording it in a way that you might end up having it seen or taken from you or in any way insecure. So there's absolutely no need to record these consultations unless you have a really, really good and very clear and transparent procedure in order to what you're going to do with the information and whether or not and how you're going to dispose of it. But
Zoom is compliant as well for HIPAA. I sorry to interrupt, but I want to mention
HIPAA,
that Zoom has a HIPAA compliant version of it as well.
Yeah.
Somebody asked that question. Sorry to interrupt you, Rod.
No problem. No, that's absolutely necessary too. Of course, you've got a lot of Americans here who want to know about the HIPAA compliance as well. Yeah.
Yep.
Good. Where are we left? Yeah, somebody asks, this is an interesting question actually. Will you create a cohort so that we are moving together versus continuing to catch up with later joiners?
That's a great question. Yeah, we've been talking about this week, actually, the three of us, as to how we'll structure this. So our aim is to absolutely make sure that you have a group that you move through with together, and that you get enough personalized attention from us. So we'll be looking at total numbers, and then there may be a couple of different cohorts, but it will be moving at a similar time frame, and we'll be able to allow you to all learn from each other in the master Facebook group and things like that. So basically, we're designing this in your best interest. So we're going to be making some decisions, and we might have to shuffle things around, as Mike was saying, but we're going to allow everyone to learn from each other as much as possible. So even if we split things up, we'll make sure that you're all having the same experience. And I think the key thing is we know we have to move, and it's quick even for us, but we had to set the date on this to start at April 6th. And I realize maybe some of you are still engaged in hospital duties and that sort of thing, but we had to make the move because we do need to be ready for the hope phase. So we're starting this April 6th. So this is why we're spending the time with you now. Today, we're spending so much time. We wanted to give you all the information so that you could make the decision as to whether you want to go through this process with us now and come out ready to speed ahead once we're through the lockdown. So April 6th is the date. Rod, did you want to, yeah, there's a question here about discounts. And I think, would you recommend going strong on discounts for surgeries with the possibility to reschedule their procedure when all of this settles down a bit?
I wonder if they really mean reschedule or reprogram, and I'm not sure what that means.
No, I'm not quite sure.
Okay, so I'm gonna make an assumption. If you're in there, Juan, if you can, because it's material, if you help us understand what you mean by reprogram, or if you mean reschedule, just let us know it's reschedule. So I'll try to answer the question as to reschedule. So would I recommend going strong on discounts? Well, look, again, this relates distinctly to the nature of your practice and who your avatar is. Okay, first of all, it all comes down to the most, the most basic principles of marketing is my avatar going to respond to discounts at all? Okay, is that what they're after? Okay, so that's one question. Secondly is, because all of a sudden, if you've been operating in a space where you don't offer discounts and all of a sudden you start offering discounts now, well, you're going to have to provide some kind of reasoning behind that. Now, maybe there's a play there. Maybe you can talk about, the reasoning behind providing a discount. One of the reasons I don't like to offer discounts, or why I don't like to recommend my clients offer discounts, is because then they get used to discounts. And then they have to wonder, it's like, well, if you can offer your services that little money, unless there's a valid reason, and it's with laser eye surgery, it's kind of hard to do that. I mean, at the end of the day, you get the laser eye surgery, or you don't. Because the result is the same, then in that case, I'm a little bit wary of offering a discount, because then people would say, oh, okay, well, clearly they can offer it for little, so why don't I just wait to the future when they offer it for little again? And then what you do is you train your market to wait for discounts. So that's one thing. The other thing about discounts is that I'd be concerned about is, again, like I said earlier, is you got to have that margin. When you discount a price, what you do to margin is often way worse, okay? And I'd love to get into this in a deeper conversation when we talk about the actual effect on margin when you reduce a discount. But when you take, say, £100 or $100 off a price, you're removing a lot more from the margin. And margin is what you're going to need most in the future, right? Because when you get into the one at a time social distancing game, you got to pay for that somehow. So that's my concern around discounts. But look, I mean, in a particularly focused circumstance, maybe there's an opportunity. I'd have to know more. But look, I hope you get on the program so we can have that discussion.
Yeah, that's a great point. I think just one point I would add to that is that, again, keep in mind that the reason why a lot of clinics have done offering a discounted price is to kind of compete against the $220, $250, $495 and offers that are out there. I totally get it, especially in North America or in the United States. That's a very prevalent offer that a lot of people have done. But keeping in mind that your ability now, the mindset of our buyers, of our prospective patients, is shifting every single day now, given the crisis that we're going through. And I think, if you try to come out on the back end being the low cost provider, you're not going to have the volume and margin to be able to sustain yourself it's just like that margin is not going to be there. So I think that just helping you to kind of shift your mind and have it to be more about that individualized premium experience, that's where I'd be advocating to go. And you don't even necessarily need to advertise a discount to be able to do that.
Victor's asked, how can I register for the course, and has someone already registered? The answer to the second question is absolutely yes. The answer to the first question, Georgie, if you can put that link in the chat again, so that Victor can take advantage of registering. He'd like to register. Looks like he'd like to get on there as soon as possible.
Okay, great. Any more questions? Any other burning questions that we can help you with? We're happy to stay on here for another 5 minutes or so. And if there's any final questions, get them all out now. What do you kind of see happening for you in the boredom phases and the hope phase? What are you struggling with right now? What can we help clarify?
While we're waiting for a question, I see Michael. I think you might have answered this question before, but just in case Michael asked the question, is it okay to use this analysis and implement the plan into a dental practice as well? Yes, absolutely. Use this analysis. There's really no significant difference. I mean, we believe what's going to happen to the laser refractive surgery and the cataract surgery field is going to happen to the dental. It's going to happen to the cosmetic. It's going to happen. So there are some clinics in here probably that actually do a little bit of both too. I mean, I know a lot of ophthalmologists do some plastic work, oculoplastic work, and some of you have gotten into Botox and aesthetics and things like that. I have a feeling that maybe you're not doing dentistry in eyes, but look, at the end of the day, this is going to hit us all. And if there's nobody in your space, if there's nobody in dental who's doing something like this, and I've not seen anybody do something like this in any space, I think we're really, really ahead of the game. But if there's nobody doing something in your specific space, then look, climb on board, because everything that we're going to teach you is going to be exceedingly useful for what you do. You are most definitely going to get the value. There's no question. I mean, look, you're a dentist. We're talking about a minor cosmetic procedure in the overall scope of things is going to pay for this, and you're definother going to get one.
Especially the strategy, Rob, because the strategy that we put together here is transferable to any other elective surgery market.
Sure,
you know what I mean? And everything that is in the certification courses with digital marketer is transferable to your industry. Because, and one of the things that I've learned that has been really impactful in my life is that for those of you who aren't in the ophthalmology space, a lot of times, if you can be able to identify a strategy that has worked in a different market and you bring it into your space, it can have that geometric positive effect because nobody else is doing it. And so it's actually an advantage, I would think, if you aren't in the ophthalmology space, to go through this, because you're going to be able to see something that's on the forefront that maybe other people in your space aren't looking at. And so I think that there's actually, for me, the tactics, yes, they might be a little bit different. The words that we have on the page and what's inside, the questions we have in the self-tests and all that stuff. But 80 to 90% of the strategy is all transferable to any elective surgery space.
Yeah, absolutely. Yeah. Amanda's got a question here about, how do you have your patients come into the clinic? Do you think that we should have, even 50% of the normal patient load every hour? We're actually saying, Amanda, that actually, no, we actually want to go more exclusive than that and more safe than that, especially in the hope phase when there is the chance of reinfection. We're actually suggesting one at a time, or as close to that as possible, or putting protocols in place. And you can plan this where you can absolutely guarantee that if somebody's going to come in, you're going to wipe everything down. They're going to have minimal exposure to people, and you've thought through the entire process, and you communicate to that on your website how you've thought through that process so that their safety is absolutely guaranteed. We had some other questions. I think we had that similar question. I think Leonardo had a similar slant on that from Brazil about the safety and how do you cover that. And I think this is going to be a pivotal concern in the hope phase, especially for cataract. They're in the older demographic. And I think realistically, the only way, we're not sort of saying, let's sell cataract, like let's endanger older people. That is not what this is about. A sales, of course, that's a nice benefit. But what we're saying here is that you're always weighing up pros and cons. And there's so many cons to waiting and waiting and waiting for your cataract surgery. If you were just about to have it done and your functional vision is impaired, it's going to be a big deal for those last years of your life to not be able to function and do the things that you want to do. So they have to weigh that up. And I think that if the pro is there for them to be able to safely have it done, and it's on you to convince them that you can do that. So the less people, the better. So we would suggest finding a way to do it as close to one-on-one as you can to keep it absolutely safe, particularly for cataract.
I think Amanda also asked, should doctors and optometrists wear gloves and masks? Yes.
Yeah.
Look, we're not like health and safety people, but I can tell you this. I know many ophthalmologists who are working in the front lines because we have an NHS here, a National Health Service. So ophthalmologists, especially junior ones and trainees, are being seconded to the front lines to deal with emergency COVID patients. And I can't tell you how many ophthalmologists have already contracted the infection. So yes, it's, look, your ophthalmologist and your optometrist definitely need to be protected. It's mandatory. So yeah, don't mess with that. That's a must.
Yeah.
Victor asks, is bank transfer as a payment option possible? Is it, Laura?
Yeah, no, we have, well, in a manner of speaking, yes. So we can, I'm not sure if the link's up there, maybe somebody can answer this, but we do have the ability to get a PayPal link. So if you've got a PayPal account, you can pay via bank transfer via PayPal, then that's a possibility as well.
So how do we make that work?
We can sort that out. So yeah, Victor, if that's the case, what I would do is if it's not available, and maybe Georgie can answer if it's available on the page now, I'm not sure that it is. If you respond, Victor, to your email that you're going to get directly following the webinar, just say what you need, say what you'd like to do, and then you will get a PayPal link so that you're able to register.
Isaac is back from his video consult. So Isaac just did a video consult.
Oh, wow.
He had to leave the webinar to do a video consult. He came back and he says, my consult seems interested in joining our LASIK waitlist.
Well done.
He transferred her to our scheduling.
Wow, well done. So well done.
Awesome. That's fantastic. I love it. Action right there.
Yes, that's what this group's about. That's great.
Yeah, that's exactly.
And celebrating successes. I think that's going to be really important during this time. We have to really see ourselves moving ahead and celebrate the wins that we have.
Yeah. I just want to acknowledge Milton, who asked the question that's more of a clinical nature. Milton, we're not qualified to answer those kind of questions. I mean, there's people who are much more qualified to answer that. I'm sure you probably gathered that as a result of the main topic focus of this webinar. So I would suggest that you take your question to another doctor.
What I would say about that, though, I mean, we have had a couple of colleagues in this group have asked medical related questions, and part of why we're all opening up a Facebook group, and part of why we're offering you to network with each other is this, because there are going to be unusual situations arising with patients during this time that you should rely on each other. And we really do want to foster a sense of community in this program. I realize that some of you may be competitors. It's probably unlikely in a program like this with cities all around the world, but say you are, I think this is the time where we foster a community where we work together. So those types of questions, we would really, suggest that you set up a thread in our Facebook community and say, okay, here's where we discuss, medical questions, where obviously, anonymously, so that it's GDPR compliant, but you can talk about cases and say, okay, I have these strange things coming up now. I don't have access to the OR. We're doing this and that, and you can actually help each other out. So
brilliant point. I think that on that note, we know that ASCRS is canceled, right? And there's a very good chance that ESCRS is going to be canceled. So these are your big meetings that you all look forward to. And I know you probably all have national meetings and meetings elsewhere in the world that you all look forward to. Many of these are just not going to happen. Now, hopefully they come out with some online options, and I think some are already considering that. But this is also part of that too. So, you know, like getting in touch with colleagues and people who are going through the same thing as you are, it's absolutely essential. So, you know, we love it, and I'm sure you will too. Look, on that note, unless anybody has anything else to say, or, you know, I think we round this up. Do you all agree?
Yeah.
No, thank you so much, everybody. Really, we have 80 people that are still listening along. Many people have signed up, and we're really excited to start the program with you. If you're one of the few that haven't signed up yet and you're still considering, what I would suggest to do is make that choice very soon. We're going to be setting up the people into groups really immediately starting next week. So you really should make your decision soon, because this process starts on April 6th. So you will be getting the recording, you'll be getting the link to sign up. So if you want to think about it over the weekend, feel free to do that. I think we're excited to get you started on this, and we really do believe that having a plan and taking action now in the next 2 months while people are in the boredom phase is your closest, it's not guaranteed, nothing is guaranteed, but is your most likely route to surviving the coronavirus crisis. And that is why we're presenting it to you now. Even if you don't move forward with us, you've got this template, you can rewatch the video, but taking action and taking it together in a group where you're supported is really the best way that we could suggest to you to come out of this crisis, and either maintain, as Rod said, or to win and survive and cruise past your competition. Do you guys have any final words?
Yeah, one last thing I wanted to mention is that for those of you, you're the ones that invested the time right now to be able to spend time with us here today to learn about this. But if you've got any friends or colleagues that so you're going to get sent the recording, and if you believe that there's somebody else that if you've gotten value from this and you'd either like to share with them the webinar recording, or if you'd like to encourage them to come join with you, please feel free when you get the follow-up email to forward that along to any colleagues, and we'll also post it up on LinkedIn and whatnot. But this is something that we want to serve the industry and the community, and have us all be able to band together and to work with each other, and to have this to be, we're able to reflect back and say, you know what, that was a pivotal moment that I was in despair, I was in panic, I didn't really know what was going on. And we want to be of service to every one of you in this industry in any way, shape, or form that we can. And the more people that we can help to do that, the better off we're all going to be able to come out of this and recover.
Super last thing is you're going to be receiving email from the domain livseasolar.com. And so, emails like sometimes go into promotions folders. So keep an eye out for that. If you just search for livseasolar.com, you will find the email. So just in case you miss it. So I think that's it. I think if there's any other questions. Somebody recently asked, is the webinar going to be recorded? Yes, it is. And we will share it with all of you who have attended. And with that, I think we will bid you adieu. And please, most importantly, stay safe.
That's it.
Remember to wash your hands, self-isolate, all of that good stuff. So social distance, that's the key. That's the key. We'll get through this.
Much gratitude.
Stay safe, everybody.
Take care. Bye-bye. Thank you very much. Thank you. You're welcome.
Thanks, everybody. Bye.